your flow. Shut the rock, says so. You don't know.
Good afternoon, Adofonum Nanaya Nyaku Ana Ewie Wati Mene Ewo Rainbow Radio Studio. Hi, I hope baby I wanna more boko. Enedia enye akwadro cry edne Dr. Oppong Nana Apraku komo o Nana Apraku Oppong edini nyina enedia insempi wo ho amepese ene obiebie enimo etreying if you say your health very very important. Any doctor to drink common severe in Sembi Akokosu and saying so, especially this last week, the past few days, and so Ghana me per se explore kakra. And there are a few other things. It's in Mr. Why you had till 4 o'clock if ye to bet me and our friend when you be a catcher and says, our young lady, no, you're down for no. Everything we have in hand. She's back in the studio with her live edutainment show. Tina Naya Nyakwe, Micha when you na doses of glorious Jesus, obviously my brain na waye amami. Timuma inti na se isi amobesai atimini bio.
Sana
Daughters of Glorious Jesus almost say baby na why ama me ewo afimu media ya na me kan se na wotwe mu bebre na Nyankopon why ama ye o bebre na so say abije nyanya me na why bibia ama me but whatever it is we're thankful say yakot na watching about because Nana ya me show that weekly Dr. Befrain around 1:15 and everyone send bebre busana ya na mpese ya hwese anyi bia anya real bebre no ya na ifri and from his experience as a doctor and a general practitioner no things that are more a broad scope of areas to cover then ya real sana ya na ebani nim na eden na timi a course bibi o ha ya nipa no anyi bia betimi ya be ma ya boy ya ho ban afisa ya real bi ho ana so then and also see a case underlying medical reason and timi ma obi eyare na se otimi kwa ewu from COVID ya na sa ebi kwa mpo anything. So those are some of the things I want to ask him. Esi I made more back Ghana now what dreams so yes see yeti no se presidents or more you know more excess ni obi and say more salary more sika pucho. I don't really understand that. It's the video ni na beton China any doctor to drink komoria and then we go there. And then Nyari Wasemi so kind of young. I don't think she's young. She's 40 years old. Nikuno Eddie 45. Nikuno stroke for some time, affecting the human being in a lot of ways. I see her to me Jumayena Afnawana so in your own confession or see Nanaya confession is good for the soul but bad for the reputation. And I think that or Sapeni Honsuo baby, but I may come a bit more at trouble. For now, no DSP Kofi Sapon or say I like to listen or play a lot of music. Never want me a home up. John in team quarantine. We so I hope so. Yeah. We ban out my DSP so am I and I enjoy because he does really beautiful songs and it more I enjoy. Well, I make my sister and Linda of Foriampon. So I say a very warm greetings to everyone on board. Sister Linda, and thank you for tuning in. Nana, what you hear call saying in my war? Adi Jamaica, is this Sunny about dear now? See, how are you? I'm very well, thank you. Now, so it's the same. Well, mommy call a humane so now we say why not offer me ya. Hello.
Hello, Nana Dr. Oppong.
Oh, Dr. Oppong, Nana Apraku Oppong.
Yeah.
Maybe I cover Doctor Nampacho what to say.
Yeah, we are doing vocal. Now also.
Maybe I'll show vocal. Now, Doctor Owoho. Dr. Owoho. Okay. Now, yeah, over country and answer over Cambro for doctor.
Oh, I think there's a very mix of. There's a West View, how ultimately enjoying what she a very mix of the two.
Okay, yeah, see. And you're not Nissan, Doctor Me Pacho, over that who Eddie actually, me listeners, any me viewers in so Kakra and answer same.
Okay, sure. And she said your kind, Dr. Nana Apraku Oppong. Currently a general practitioner. I've been a general practitioner for the last, since 2008, or many years ago. I worked in hospital for some years before moving on to general practice. I'm in Ghana, and I've been in the UK for since about 2002. Lots of experience, and hopefully I can impart some of that and answer or help find solutions to some of the queries that your listeners have.
Mm-hmm. Doctor Amidase, oh yeah, general practitioner. I am Bridget. Can you say GP? Maybe.
Yes.
Now, me pacho or background this. Do you have family or are you single? What's your story, doctor?
Okay. Yes, I married with 3 children, from 9 to 12. And yes, good family life, and live in London, South London.
Okay, so doctor also was 3 children.
Yes.
So doctors, they are not on time will be brain.
Oh, said 3 the end of society now.
Like Doctor Nam person me tap in with a sense of humor and so to say now because Obi send me busa question. I say Obi because Mark. I see what nickname be our mother in trying to get to know you a bit more. Do you care to share and I say me reveal a nickname now Martin?
Oh, I don't say Mark will try to pull my leg, but Angel Doctor is a nickname.
Oh, I thought I heard it as Dr. Evil.
That is what the trick they try to play on me, because almost same within Angel.
It's evil, but Dr. Angel more me boy.
Exactly.
And how beautiful. And I think, not that I think, that's the wrong way. Because as a Ghanaian, when I meet people like yourselves, I'm more expertise, and especially more training from Ghana now, but maybe I make it that much impact in England or elsewhere. And I'm very impressed by. And to doctor, as a general practitioner and a GP, what's within your remit? What sort of areas do you cover?
Well, I mean, as the title says, I mean, we cover everything really. I mean, most diseases are managed, very well. If you hear support from specialists in certain particular areas, then we involve them. And again, Sunny Canadian, I had a lot of experience working in hospital for quite a while before transitioning to general practice. I'm quite comfortable in all areas. Of course, nobody knows it all. You will always decide to go and find answers or to the appropriate sources for answers.
Okay, that's beautiful. And into doctor, as a GP, and from your experience, ayana ya ben sana eba we need to look at. And Uriam Pesemi Busa will be about the demographics of our group now, so.
With general practice in NHS, it's set up from cradle to grave, and we share from when they are born all the way through to when they die. The beauty of that is because you get to know families very well, you get to know people very well, and you see their journey, and it gives you a good grasp of what could potentially be happening with them and how to offer support or how to help them. And that makes general practice quite unique. And we see also, but of course, I think, and then we probably focus on a few of the things that you see, if they are affected, more, which tends to be diabetes and hypertension, and those are the two main ones that you are there as well.
Okay, and waka diabetes, Dr. Wasayaka hypertension. I think, sir, if you allow me, so I would want to throw in a stroke as well. Until if a time be because I think that now saying young people ain't a stroke more than pinning for. Unlike before, as I was growing up, and I'm stroke not impeding for more than I mean himself more. But before we go into that, Dr. Oppong, me patch over to me actually in secondary school now because Carlos and Nana Apraku Oppong Eugene our line is so many from secondary school. Me patch muka grandma why. I'll say what's it called? The other one, Prempe, or which one did you go to, Doctor?
For the best secondary school in Ghana, which is the one that for Edindaso, Opokuwari Secondary School.
Oh, so you're Prempe, but they are Opokuwari.
Oh no! Prempe there. We will go no. You go to Opokuwari, and then you meet good compatriots like you mentioned the names, and then you go through that and achieve great things.
Okay, into Dr. Ubetia omunso amaya kate for na was na mutie wana so mu watch no.
Oh yes, of course. Seniors and juniors and mates, Miss Aluchionia Akateche is a great association to be a member of. I'm privileged to know these guys and having shared the developing years of my life, shaping me to be who I am. I salute them all. It's been a great part of my life.
Excellent. Into Dr. Yemfayen common in Shesheswe. Tell me more about Saya ya boboss no adentina what we are say bebre and why does it affect people of our race even more than others
Yes, I mean I think quite interesting. So I mean so that's for hypertension, which I know earlier said you can't say they come about strokes, but talking about stroke, really we have to talk about hypertension because hypertension and the cause of stroke. And if we tackle hypertension, then by effect, stroke is also covered because if you control your blood pressure, then your risk of stroke would be very, very minimal. Now, hypertension, there are two types of hypertension. Yes, so it be essential. You say medicine, you say essential. You instead of mean the exact cause, but you mean normal contributed to it. I don't know if the major cause of hypertension or the main bulk of hypertension is something called essential hypertension. Now, there are other types of hypertension which is only maybe like under less than 5% and go for more kidney disease, adrenal disease, almost continuous hypertension. But then only a small part, and the treatment is quite specific. But by far, the main bulk of hypertension is essential hypertension. So then you need the exact cause for it, but you need there are certain things that are risk factors that if you have, means your risk of getting it is much higher. Now, unfortunately, genetics plays a part. Now, in say Afro-Caribbeans, there was slightly higher genetic risk of getting hypertension and even diabetes, same as the Southeast Asian. And the genetic risk is there, unfortunately, or risk of stroke, but there are other things that will be to reduce the risk. And that again fits into the things that lead to it, because if we know the things that lead to it now tackle that, then your risk goes down. And the main thing, genetics, that we know, say, okay, we cannot do that much about it. But other things like diet, what you eat, exercise, smoking, drinking, these are major factors that drive hypertension, and even diabetes as well. Again, weight gain. The main contributors to hypertension and diabetes. Now, with a Chrome unfortunately, the lifestyle of Chrome also is quite different from the lifestyle we have when we live back home. I know so now come back home to HMD, and unfortunately with that, they are also getting more of the diabetes and hypertension. But certainly it's that kind of sedentary, high pressure lifestyle where long hours, working hard, you do 3-hour break, you eat, you sleep. There's no time to want to do exercise, relaxation activities, to have a good diet. You easily gain weight because again the diet here is quite high fat, high sugar diet, which again why a lot of stress, people high pressure, chasing money, a lot of pressure to succeed and to move on. All these things are together. It's like a pressure cooker, which drives up a lot of these diabetes and hypertension.
I see. Some more. I wanted to explore something around food, and because Obi Akatram is sometimes simple lifestyle changes can put us in check against animal. I wonder, so what kind of high blood pressure? Is there or are there any things that so you bet me worse than such as what we eat?
Oh no, yeah, definitely. I mean, for both blood pressure and diabetes, diet is quite crucial. Now we know that for especially for Afro-Caribbeans, talking about diet, we know that they're quite sensitive to salt, and that's just because of the way our kidneys are structurally slightly different from the Caucasians, and very salt sensitive. And if you have a high salt diet, that you are at risk of pushing your blood pressure up. Again, if you have a high carbohydrate diet, again, you're at risk of weight gain because a lot of calories floating around, which gets stored in the body as fat, increases can increase your blood pressure, your cholesterol, your blood sugar. That is again quite a big factor. We don't eat lots of vegetables, which can also have the antioxidants that help to improve our metabolism and our circulation. Again, that is a risk factor. This is something that WHO has recognized quite clearly, that sugars or carbohydrates are the main danger in terms of some of these diseases, like hypertension, diabetes especially. And if we can tackle that, definitely, even at the moment, there are a lot of studies going on in London where some of our patients have been enrolled. There's one called Oviva, where they targeting patients with diabetes and putting them on a low-calorie diet, so 800 calories a day, which is quite strict and quite difficult. But they're doing that for 6 weeks and monitoring these patients, and I'm sure those that are able to stick to it, a lot of them can reverse their diabetes. Because we know, let's say, people people who are quite very, very much overweight, when they have weight loss surgery and they lose significant amount of weight, the diabetes goes, the hypertension goes. And we know there's evidence that says that if you can reverse the weight loss now, some of these things would resolve themselves. And when we're talking about diet, there is good evidence because we know it is a driver, and if you can tackle it, then you can reverse some of these problems.
I see. Some people will argue, sir, arbitrary lifestyle naturally it pushes you to be a little bit careless with health. Would you agree with that or disagree, doctor?
No, I think the temptations are there, of course, because there's easy access to sweets, to junk food. At least you have money to be able to buy any of these foods that you like or that you fancy. And of course, eating out and buying these foods, that helps to drive up some of these problems. And again, there's lots of studies showing that even like around schools where they have these fast food joints, it contributes to child obesity. There's a lot of evidence out there, and yes, because people have the purchasing power, they can do some of these things that are unhealthy. But in the end, we have to control our own destiny, isn't it? And deal down a path where your blood pressure is going up, you're starting to get diabetes, which then can lead to stroke and heart disease. Now, if you don't want to tackle it, then of course you have yourself to blame. And there's something that you can do. It's a change of lifestyle. It's never easy, but if you look at the big picture and look at the goal you want to achieve, it is very well doable.
Okay, doctor. I think, sir, in terms of blood pressure, so high blood pressure. Actually, no, let's say blood pressure. And please correct me if I say something incorrect because it's not my expertise. You see, utibina low blood pressure or high blood pressure. And what's the difference between the two? Now, blood pressure, no level being okay. Now, level being dangerous, doctor.
Okay, so normally, your blood pressure, you measure you get 2 readings from blood pressure.
Mm-hmm.
And whether you think of it as your heart is in the middle of your chest, and there are tubes, arteries that go from the heart to supply blood to the rest of the body. And then you have veins that bring the blood back to the heart. And it's like a closed loop. And the heart pumps the blood out, it goes out into the vessels, the arteries goes round, comes back in the veins to the heart again to be pumped out again. The heart is pumping about 5 liters of blood roughly around the body. And the heart, once it pushes out the blood, that is the highest pressure in the vessels because the heart squeezes out the blood into the pressure in the vessels or the tubes goes up. Mm-hmm. That is your systolic blood pressure. Then the heart relaxes whilst waiting for the blood to come back and fill it up again. And that is, you get another reading, that's your diastolic blood pressure. And you always have 2 readings, systolic and diastolic reading. Now, over time, because we study and we say your blood pressure generally should be between 110 to 140 for the top, which is the systolic, mm-hmm. and the bottom, which is the diastolic, should be between 70 and 90. Sometimes, especially younger women, it can be a little bit lower. It can be about maybe 100/60, but we're expecting roughly between, let's say, the 110 to 140 at the top, mm-hmm. and then at the bottom, from 70 to 90. Now, if you're getting blood pressure readings over 140/90 on a regular basis, then you need to see somebody about it. Mm-hmm. The unfortunate thing about blood pressure is that a lot of people with high blood pressure, they don't get any symptoms. Majority, maybe 90% of people will not get any symptoms until they won't know that they have high blood pressure until, unfortunately, a stroke happens, and then they start to get a stroke, and then they are taken to hospital, and then they realize that, you had high blood pressure. A few people who have symptoms, they will get maybe like headache, throbbing headache, pressure in the head, sometimes palpitations, sometimes dizziness. That's then kind of majority of people won't get any symptoms. And general mania is dangerous because they're a silent killer. Officer will be okay until starting the pain when a stroke now that thing. And the engineer can say, D40 now 40 or at least once a year, so we go check up, check your blood pressure, check your blood sugar, cholesterol, nisanium, na so your bema so Africa bema from 50 kono at least once a year, so for check your PSA prostate test. Again, that's something that maybe we can talk about another day because the higher risk of having prostate cancer and we need to 50 kono once a year, so for check your prostate PSA blood test. And the blood pressure, the canvas blood pressure, 140 over 90, the broso, a costral, the all checking a regular net broso, also na doctor na pharmacist na or take action. This time blood pressure machine quite easy and quite cheap to buy. 20 pounds cabinet, we can check your idea will be once every few months. No, I check your share. They was sure then of course check it more regularly. But still say more than 140 over 19 and I say repeated that and also go more. Now high blood pressure or just hypertension and then it's dangerous. Some people just say low blood pressure, but low blood pressure really. So blood pressure go too low, but they below 110 over 60 now. The worst that can happen is you feel dizzy, you faint. When you're top of now, when you're lying flat, your blood pressure stabilizes. When you're at the gym, you're up and going. A lot of fluid, drink a lot of fluid will help to keep the blood pressure in the normal range. And the low blood pressure, it's not something we should really worry about at all, or even bother ourselves with, because the worst that can happen is that it's fainting. But of course, high blood pressure, hypertension is the danger, because there's stroke, heart attack, all these things, kidney failure. That's one of the things that we haven't mentioned. Again, hypertension, any diabetes, maybe one of the main causes of kidney failure. Young people normally have kidney failure, no more dialysis. Now, we have transplant. A major problem. The low blood pressure there, and forget about it. It is not an issue at all.
Okay, that's beautiful. Doctor, I'll be up a line. So I'm interested. Be no question. Be mawa. Hello.
Yeah.
Hello, Pacho. Why no line is we? Hello. Dr. Yentwasam said nipa no on kasa number ne end 38 inti mpacho sa wo so a wo kwan sa obe kasa why Dr. Apraku.
Yeah.
Dr. Yentwaso me pacho nipa no on kasa inti abiana obe kasa tree.
Okay, no problem.
Inti yaka high blood pressure ho asem kakra wo say say obi who say when you headaches, not other symptoms I'll describe it and say a man drinks also a checkup. Or your bounce now say we were in your 40s, I'll say once every year no or checkup. Me patch your sign corner.
Oh yeah, and you'll be once you are in your 40s, once a year also a checkup. So they can hypertension or high blood pressure. No, majority of people in here you want to check here, you wouldn't know the cause. Only a few nominations until we are for 40 on the other once a year of checkup. And a member in prostate cancer affecting member until from 50 on also we check it once a year, we have blood test now check it for risk. Even or family say or papa na or brother na be saying prostate cancer that then even we say from 40 grams on also start to check it once a year. But the only high risk then from 15 at least once a year. But anyway, we can have a discussion another day.
Matters, 80 Dr. Sawiya GP Nasa Obiba or else or Kase or bookie appointment for general checkup on us saying I or send nipan a presenting and what you say.
Oh yes, you just book your appointment for a routine check, a routine health check. And sometimes come for nurse and then check obey your pressure or your weight. No, I say BMI near the normal advice. If you are weight, if you are weight, you can BMI or 30 and now over until so we to 2 eatings and the wow pressure no be no amount form now the blood test. Sometimes doctor, sometimes nurse, but they pass straightforward. They're not all booking for a routine health check.
Okay, yes. Doctor, Yenka a diabetes is one some kakra.
Yes, and I mean, a factors, a lot of them affected diabetes, may hypertension, and the same. Again, diabetes, so unfortunately, certain races or risk, higher risk than others. Again, Afro-Caribbean, Southeast Asian, a little higher risk of diabetes than Caucasians. But of course, almost so other things they affect you more than that. You win some, you lose some, as they say. Now, diabetes, again, genetic pattern here, won't be diabetes or risk cluster. And also making sure that other factors all tackle very, very well to bring down the risk of you getting diabetes in the future. And again, you say diabetes, there are two types of diabetes. One is type 1 diabetes, which because your immune system and are more functioning here and attack your pancreas. So pancreas produces insulin and then maintain your blood sugar in the normal range. And this pancreas not gets destroyed by your immune system. So now won't be producing any insulin, so then you get diabetes. And you type 1 diabetes. And you have to start on insulin injection. And it tends to be younger people now affect you. But only a small, very, very small percentage, again, bare 5% of total diabetes. Type 2 diabetes, and only by far the main bulk of diabetes. And mainly driven by weight gain and diet. And the populations say almost actually gaining weight more now diabetes I much more rampant. And then I can say again back home now a lot of diabetes because the lifestyle has changed, people are much more heavier, a lot of weight gain, and then diabetes it's rapidly rising. And to come as who put you on weight, who do a lot of carbohydrates, a lot of sugar, when you exercise.
Okay, I'm saying Lucy Dr. Apraku Oppong, Obesai Afre back. Hopefully Obesai Afre back. In the meantime, Mama, we say hello.
Hello.
Doctor, we lost you.
What happened? My line went off. But anyway, as I was saying, yes, these factors are the main driver for diabetes. Mainly say you make sure that you lose weight if you are overweight. Weight loss is the main thing. Now, of course, to lose weight, you need to cut down your calorie intake. And the main risk is carbohydrates, starchy food. And you also making sure that starchy foods, what cutting it down. If you also have diabetes, also make this sugar, but you are not or the rice is in anima that December and within 1 day. And the carbohydrates and not just sugar. All carbohydrates, rice, potato, yam, ripe plantain, bread, all carbohydrates are risk factors. Now, of course, you need the only carbohydrate for your energy intake. But we imagine say the in a day, if you put it on a platter, it will say maximum 30%, and a carbohydrate in a day.
Dr. Mpacho Mebao, yaka carbohydrates. I know say Africans, mainly carbohydrate based. You do rice, you do bayre, you do what do we? Doctor, with you, my main display my ignorance publicly. What do we get from plantain? But then MIA, iron, me boy.
Well, there's a little bit of iron, and massive iron, a little bit of iron, and then carbohydrates. Yeah.
Okay, into sign you near Abubodini na carb based. Into what can be said 30% of carbohydrates in a day. But will be ready I don't know, how do you break it down then into Janya in a typical day, no?
Yes, and you say you have to imagine if it's called like a food plate. You imagine say Jana would do the whole day, if it's on one platter, 30% pen also carbohydrate, and you say broth. Now the next 30% should be vegetables. Now I know that a lot of us from back home now you shouldn't be vegetables, but a idea of science, diet. They also you incorporate, there's no way around it because one farm with the animal will risk never cost through, and over time, diabetes anyway setting. Again, even some bowel cancer near the crown, a diet can also increase your risk if you're not having more of the vegetables and fruit again. And you carbohydrates 30%, vegetables 30%, protein 30%. Now 10% now is a little bit of oil, nuts near the SNI. And we might say carbohydrates are in a day, already the whole day, they'll say only 30%. If you just have that in your mind now working based on that, you'll find that well the weight. Now the exercise will come on, then you see the reduce the risk of hypertension and diabetes drastically. Now exercise and so you can't exercise also cardiovascular exercise. And yes, you call scheduling now cardiovascular exercise, walking, so brisk walking because they'll say be a bit more sweaty, then you have to across now sustaining for 45 minutes. Into walking, swimming, jogging, cycling, also for 45 minutes. Now also for ideally 5 days a week, but the only thing you can now 3 days a week is better than nothing. And ideally 5 days a week, 45 minutes regular cardiovascular exercise. Now that your main idea will impact on blood pressure and blood sugar. So yes, our regular exercise, 45 minutes a day, cardiovascular, brisk regular exercise, 5 days a week. I know everything do pressure now performed by about 10 systolic. Now it's a sound diet or cutting down carbohydrates to no more than 30% will lose weight. And also waiting do pressure now performed by another 10 on the top and maybe another 5 on the bottom. And you can just say, oh yeah, you together. That's all pressure no extra. And no can bring the pressure down or the blood sugar down. And there are loads of examples of Nkofua or diagnosed that they make these changes and they control their blood sugar and their blood pressure without medication. Of course, some people will still need medication on top of these changes. But if they do grandpa, then they don't need as much medication as they would if they didn't make some of these changes. And the changes are always beneficial, regardless of whether in the end you have to have medication on top or not. But these are the main things that you can do to improve your lifestyle, to ensure you live longer, have a healthier life, and enjoy life as much as you can.
Dr. Wakasa Kamapa, I wonder if it's okay to take a break. Not yen tea and you bear seba kumye nubians and not yen saima umbra. A question biaba or semi busa. But what do you think about a break, doctor?
Yeah, no, that's fine.
Okay, good. Before we take that break, no, per se volume 2, but a question being say, yes, sister Linda of Foriampon. So see, hi Nana, please ask doctor that if you fight a lot and not let things go and move on, can that increase your blood pressure?
That's a very interesting question.
And to Dr. Jenny Homa in about 10 minutes, me pacho. So actually, no, let's make it 5 minutes, just one song, not what's after. And I want to know what role sex has got to play in all this. We're talking about cardiovascular exercise. Does it play any role, Anna? Inti, Dr. Oba, na ya dream home. What do you say?
Okay, no problem. May I end and call back to that. So.
Pacho, I don't want you to hang on to Pacho. Just hang up and then let's listen to one track and then you can call us back, please, Doctor. Thank you.
Okay, no problem.
1847 wa join ya Nana ya kon ene Dr. Nana Oppong Apraku ana etwetwe nkomo. It's all about health, it's all about our health, yours and mine. To Mr. Wasa wo asem bi se bia obetimi apostle ama doctor na well, he is educating us into hopefully yen free ahan kone na yesua enema bebre so every doctor and chain wasem bisa any sense so betimi na wa post ama me wo Facebook video no so na ye de ama doctor na we yi ano ama em. I'm trying to look for a track. Okay, I don't like that one. So I'm going to find a beautiful track for us to listen to. There is a song by DSP Kofi Sapon, Osi Ayi Enyum, and that's a song. I don't even know, sir. Oh yeah, and that Yawomia, but it's one song I've always enjoyed listening to it. So whilst we listen to that, question beyond per se, you fire my doctor. Now, dear Bremy, Auntie Esther Dolligan, Bruni Yuri. I thank you for tuning in. Why? Across upon Joshua, me who sell thank you for tuning in. I hope so. Who yeah, and your crowns metal in and person Michelle views on our health way no. Honorable Samuel Ayepe Michalpa, cross upon Michal, you call me also a child brimpon Michalpa. I'm the doctor at Saying Abba. I will tell me any doctor to drink commoni we pay me person me who especially Honorable Ayepe. As an MP in Ghana, what are your views about this presidential wife salary? No, and the DM said me blood pressure, back stroke, Dr. Apraku, so to me for. Doctor, what's it about? Hello.
Hello.
Akwaba, doctor, and thank you once again for your time.
Yeah, no problem. So anything we can do to help our people, I think it's worth it.
Excellent, doctor. I do pacho asamna yes sister ni busae no. Ubetimi ya no amae na bia also ne na mi some person me hono so. O dia ka ho amae, doctor.
Matthew, no problem. No, I think certain time a very, very interesting question. Now, also may come about the risk factors for the hypertension, diabetes, and mentioned stress. Now, you just stress if you are chronically stressed or high stress levels a more producing hormone be a friend of cortisol. Now, that hormone no produce it means our metabolism and my store fat near the and also then lead to hypertension, diabetes. Definitely, high levels of stress are a problem. But it's just a kind of that will be a full term only for 3 months to get the own papa in China, my stress levels across. And it's in a Bible crack, I say. Forgiving a boa katana a one coming forgiving him. And definitely stress a big factor. In fact, of course, even night work all the time, or munching again, or more risk of hypertension, diabetes, and was so more. And stress is a big factor. Now, one of the main things you can do about stress, of course, the one that has the most evidence is exercise. So we exercise, regular exercise, a no produce that endorphins hormone via a mouth feel happier, a mouth muscles no relax more, a mouth heart rate back home, and na guama stress no a couple. And activities, relaxation activities, any more how mutinum or more read the book, any more yoga, pilates, nina, so this means guama stress a couple. And it is when again, which a new lifestyle now, yes, and when you now Bama stress to couple, Bama other things couple, that they are oppression, or blood sugar into the couple. And the sister can a very important point, the Ukraine mountain in the affected one capacity. Now, touching into the how kind of about sex and again, sex with, or shall we say, the right sex with the right partner, we know the reduce the stress because the relaxation at the end. Exercise, I mean, sure, I don't know exercise, sustain enough to be good exercise. I mean,
to no amount of sex, they're very equated to proper exercise. I bet to be out we're still on track. I will blood pressure. Was I not doctor?
When you say routine using 45 minutes of exercise, yeah, then good. But definitely a relaxation, all these endorphins stimulating while you need to bring relaxation. It definitely it has to it adds in terms of all the things that you come about stress and relaxation. Yeah.
Dr. Waya, dear, now me palcho in terms of high blood pressure, no. I had high blood pressure. I didn't have any until me bad boy when you're 14 now. Me wo nature na me nya sa blood pressure no. And since the doctor's name pesa pay me fear journals into medra me fire in that bromide 2.5 is it milligrams or something if that's the strength. And I can now.
Milligrams, yeah.
Okay. And I didn't say the obi to a droswa. More doctors more hesitant to take them off it. And here one question. The other question is say Mao a drove bisa. Is there a point where between I can say there where you not stopping here a drove you now?
Yes. I mean if you can go focus so what that you're doing and one know but in truth say who the although imagine the who journal and the amount of pressure state at low. In so journal there has to be something else in place of a journal. And in said the Ekaya, say, Fancy, who knew our exercise, not watching it, they 5 days a week, at least 45 minutes or exercise regular. I don't know what you do that for in about 2-3 months. I don't know can start to have a very good impact on the blood pressure. No, up to the point say you be near Jaya do no maintaining pressure no. Because ultimately don't know without any other changes. Any side the pressure will just go up again. You have to do something else in place of a journal. And again, so we overweight. What's the sound? Diet, what cutting down carbohydrates, we eat more vegetables, we exercise, weight are dropping. Weight, the beautiful thing with weight loss is any amount of weight loss is helpful. The even BMI 35, now we reduce the weight, now it only comes up to 33. It still has an impact. Any amount of weight loss is positive. And into why you know now we exercise now weight me back from pressure back from blood sugar back from definitely everything age pressure don't know. Usually of course they'll see a monitor regularly. You like say okay to say oh yeah exercise no pressure now by 120 or 70. Okay, that is good. Okay, now is there don't know what our machine will be. One week I will check it. 1 month I'll be home. But the home pressure is still 125 over 75. Okay, that is good. Only another 2-3 months, whereby still 120, 130 over 70 over 80. Then we are happy. Okay, then 6 months later, 1 year later, we just monitor it. But then you have to make sure the lifestyle now you maintain it because which then the pressure will just go up again. And that is what we don't want to have a stroke or something or heart disease or kidney disease or anything of those. And indeed, you can certainly come up with, but also you need to put in place of the journal. And it's the same with pressure and diabetes. You know, it's possible to come up with medication as long as you are doing something significant to replace the medication.
Doctor, I'm saying, see, Medase Power explaining the year part, you know, I will look into it. The other thing I wanted to explore with you, we touched a bit about the role of sex in this. I've seen or heard stories or situations where people in a heart attack during the act. What do you think causes a heart attack during sex, Doctor?
So, yes, blood pressure, uncontrolled. Now, you have the uncontrolled blood pressure. It means our pressure is more than 160 over 90. And indeed, the uncontrolled, because the act of sex or the acute exercise or the stress on the body at that time can push up the pressure even higher. Then it can trigger the stroke or the heart attack. And it is purely down to having uncontrolled pressure that then leads to this stroke or heart attack at that point. Because at the time you're doing the vigorous activity or exertion, your pressure will go up higher. And it's only when you do this regular exercise, as you're doing it, the pressure goes up a bit. But when you finish, then the pressure comes down even lower than where it started from. And when you sustain that, then the pressure generally stays at a lower level. But uncontrolled pressure now, at that time, then the higher risk because the pressure will go even higher, and then suddenly a stroke or heart attack happens. And to even example, the whole gym, if you go to a proper gym, they initially check because they will make sure the pressure within a certain range of standard what start the exercises. Just a precaution because if your pressure is 170 over 100, now of course that exercise then of course initially it can cause some of these complications. And you always have to make sure that again it comes down to checking it once you're over 40, checking it at least once a year to see where your pressure is.
Okay, that's beautiful. Doctor, I'll be questioning this, when you know conventional medicines now they treat it. Traditional medicines, can they help remedy some of these area I come already?
Yes, I mean, of course, conventional medicines, a lot of them are produced from the plants and things that traditional healers use. Now, the only problem, of course, is that a lot of these traditional medicines, we don't really know the active ingredients, what else is in there that can create problems or not. And unless we know for certain, we cannot recommend it. Now, unfortunately, we haven't really done the studies into these to find out exactly what are in them and what is the benefit or the risk of them. And of course, if you don't know, then you cannot recommend something because then that will be a bit of a folly to say take something that we don't really know what is in it.
I see, Doctor. I said, sir, Abrocha has sometimes what TBB say we will eda ni dem be calling na we would a hone ya fani be say be a heart attack ni nema. There is one thing about well, I don't know if it's one thing, but for I can say embema in general no omum pet hospital call any doctor call. Firstly, what are your views on that one? No cry no cry and I say no cry. And I say no cry. How can we encourage people, especially men? So say omobabe homo frequently, especially as you said, so what age group would be I was set what I a checkup at least once a year, no?
No, okay. I mean, but any before across all races that I am more reluctant to go for checkups or to seek help when you have a problem. And I think that probably inbuilt with the evolution where Obama now has to go out and hunt for food and do all this, that is part of the thing where it's more difficult to accept there's something wrong that we need help. But of course, as with all things, as societies evolve, we try and encourage the good behaviors and the bad behaviors. We try and correct them. And sometimes, really, I think the onus falls on the partners or the women in their lives to encourage them to seek help and to be open about some of these things and to tackle it. But there's something, there is a trait that over time, we can all encourage to men to overcome. There's often it's the women that have to push them to seek help or to go and see the doctor.
And then that doctor, Maya, who hear ye panty, so your bema no bani wa brabum de and nature, so watch you, and yes, sir.
Oh, of course, and yes, well known. Again, a lot of studies have shown that Obama, if you are in your 50s onwards, let's say you don't have a female partner in your life, but your life expectancy is a bit lower than those in a stable relationship. And well known that.
That's good. I hope that Obia and TBB and film quite honor a bet me I'll make a difference. But doctor, I say yeah, we are gonna need a quarantine and funny so we need to make Obio no need grat and then don't on to me call GP hop and near fact. Ain't some for near bay on day and no to see you no been to so I now ought to quine what teeny age so I know say I brought you in Ronnie Biwa your demand based on your age. Ain't how can we deal with that situation? Say bio ha or need GP crying as or need doctor because on in crat and uncle. I know being so I quite need age any papa and so you real say a money draw. I don't know. Do you have any thoughts on these things now?
Age maybe I wouldn't worry about that at all. I mean there are very, very, very few gaps now. A year determine once you're an adult, the age the dose is normally the same once you're an adult. There are very, very few drugs, now, like I said, there will be a difference. And the sample will be based on your weight rather than your age. And then, I wouldn't worry about the age. When you're adults, the doses are generally the same. Like I said, very, very few instances, they make a difference. In general, I wouldn't worry too much about it. Now, in Kazakhstan, to say across London, NHS in the Nakase who are around London has say now need TPR who can register need to be sound Katasem. This is idea NHS England are putting down in writing because Oma who said the important TB was through around London and the normal thing for unregistered or moon to need to keep up the these diseases are sort of spreading in the background. And in a written idea, you can go on the NHS England website and check. Omaka said, around London here, who calls out GP, and if sound Katasem, even address gram for them, only address gram they still have to register you. Now, I know there are a lot of practices will still, because this is what they've done over years, and they will still ask you for proof of all these things. But you can print something from the NHS England website and show them that you should still register. They should not be demanding proof of residency or proof of entitlement to them. Who go hospital for treatment, and they are different. Hospitals can demand that they see evidence of you being legally entitled in the UK. But in registering with a GP, they should not be asking you for your
legal status or something.
Being legal, yes.
Okay, yeah, doctor. Then I'm person is something about stroke. I don't know how you feel, Sabia, and come on some because it's like the younger generation now, no, almost any stroke more. You see, it's our protein powder and the other things they take, it may contributed to it. Can you shed a bit more light on that for us, and that, doctor?
Yes, I mean, it's a trying to have the designer body near the end, going to the gym and taking all this. A lot of these supplements have this steroid in them, anabolic steroids. Mm-hmm. And of course, like I mentioned earlier, this cortisol hormone, stress hormone, they are all kind of come under this steroid group of hormones, anabolic steroids. I don't know, then of course can affect your metabolism in terms of driving up the blood pressure because you retain more salt in your diet. If it is a purely protein supplement, that the risk with that is quite minimal. But a lot of them have these other supplements in them to try and help them to be able to exercise more and develop certain muscles, and those are the risky ones.
I see. In a stroke, then so I didn't know young people no more saying than the older folks, no.
And it's down purely to blood pressure because lifestyle near the blood pressure unfortunately is happening in younger and younger people, and because they are not going to seek help or to check, and so they because blood pressure, majority of people don't have any symptoms, okay, then suddenly the unfortunate happens with a stroke, and that's when they realize they will blood pressure and it's purely to do with the lifestyle, and then not seeking help or doing regular checks, and then which is very unfortunate, and because it's preventable. But if you don't check, you wouldn't know, and of course we're not doing the right things that we should be doing to reduce the risk of blood pressure and diabetes.
Dr. Wire, dear, me patcho, you better take your last break and say, I know what to uncommon. So now you're back, I perceive, share something to do with COVID. So you see, your underlying medical conditions. So be how you be not so why you see, we know underlying medical issue. Intina owu no. And any pan you now vaccines nibi or vaccine nibi. I just want to explore with you, sir. Conditions being underlying a better me ama COVID fatal ama individual be, and what precaution can people take, and then we just do some wrap up exploring your highs and lows about being a doctor. Into doctor, I take another break now. In 10 minutes this time. Nanka Wafra, if it's okay, then we're on the last leg of the talk.
Okay.
And then I'll also explore your further questions and so from viewers and listeners, and so I'm not meeting in our mouth. So we'll fire back in 10 minutes. Why, doctor?
Yeah.
Okay, thank you. It's 20 past per. It's about 8 minutes to go. Why, doctor?
Okay.
Thank you.
Number one champion.
Rainbow Radio.
Hey, yo.
Africa's best station.
Yeah.
Oh.
Yo.
Rainbow Radio. Africa's best station.
Hey, yo. Non-stop music, we are flow. Shot to Rocco says so.
Sister Jenny Sifa Asari, all the way from Paris. I thank you for tuning in. And Mary do comment no.
Yeah, branya do item. Kanta makuma mse. Body bonya manya kra. Kamino na minito. Sinede mati bibiose. Senya bayo bagi menso. Nyo do ma bi sakenti. Family wodo mo jai. Just any what them my messio. I feel I'm a young son. I see you one number 80 out there. Honey, 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 it's a wild. Oh, oh. Out there. It's a wild. Audition,
a beautiful one by Dada Katie. Or see, honey, honey.
I'm Saraba Unamani. Akoma Sonia Babi. Today, this is Makuma Mufitani. And the Yama Suakuma. And I'm a Belmacaya. Other Fubabi and Mitia. I'm a Modro. Bakuma. 18 meters. Honey, honey, honey. It's a wild. That day,
What's here, yo, don't quite Dada Katie. So I feel now I be kind son and I and ya coin out to me name. Yeni doctor Nana Apraku Oppong come question anything was sent beside anything.
Baby, I want it raw. Osaka for my yeti and CSN. I want it raw. Suddenly just so want it raw. It's in your yeah. Yeah, we're best feeling. And you come on. No. And you didn't if I come up again, you can sound. Oh, my main sensitive. I feel I'm a young son. Yes, you know, ain't to me, my person. And I'm a top person. Ain't to me, my son. And I'm a top person. Now before I and my man so I make a top dog. Now say we get down you
And then Auntie Francesca watching me chow pie or door and quan.
Oh my God, I love Rainbow Radio. many colors, many voices, one God, one station.
Phenomenon for Nana Apraku na oneme twetwe nkomo ise me na me ne won so twetwe nkomo enne yenya Dr. Nana Apraku oye GP, a General Practitioner our United Kingdom ha Dr. Ebiebi nsem bebre so atre so wo question bia na ode abana e dia ma doctor yes idea forever hold your peace. So you need to kasa for another 10-15 minutes and then we move on to look at other things. So when you are so what you need in we are very grateful for your time. So when you hire so yeah they ha me was a doctor say and you be a serving pressure sound the company for customer utu adon kwaya na it may affect your heart na or say so wakuma enye day now blood pressure near unstable there sometimes it may abasa also so wasem bisa and saying Emmanuel Akofo say but what me now comment to the doctor for shortly I made the man was saying Nana please ask the doctor that whether overeating can result in a person getting stroke please into so did you broswa it me Emma when you stroke and as say me pese you hunt you bebusa coffee aje my London guy I say honey how are you made us say so when you quite know what you need in into enchekra ya betty doctor and can ebio into then na ekoso ewo baby no one of the songs I really like and as I mentioned is an artist in so Akwabua and then you must say I do love you and this is about shortly but mama yan copy kid doctor call not yeah no entertain you common bio. Hello.
Hello. Hi.
Doctor, yeah that was say anywhere butter. Now me pacho any matter say so far.
Oh yes, on my side yes, everything is good.
That's excellent. Obi said that's excellent, doctor. Obi say you musa say and you be overeating it to me cause stroke and as saying Obi to me ye no amai and sana ya twaso.
Overeating not directly to stroke, but overeating it may lead to hypertension or diabetes and then to the stroke. And see there will be an intermediate step of your blood pressure or your blood sugar going up, which then leads to the stroke. And yes, it can, but not directly as that. Yeah.
Okay, and to overeating, the doctor, is it for a prolonged period of time? Let me money basa. And yes, I be a one of now what they could contain you piled up food to eat. We are now in a stroke. Saying yes, I know, and I'm one. And to not just a kakra wakano, so be benya stroke, high blood pressure. And sana when you stroke. Diabetes instant may contributed to stroke and our doctor.
Oh, I mean, also hypertension by far the greatest cause, but yes, diabetes is the cause.
And to these young people, I'll bet you see when you stroke and accident, and them say, the blood pressure and I build it up, answer. And I say, how does it work? And son will be, yes, it will be a collapse when you stroke.
Well, yes, definitely, my blood pressure would have built up maybe even a year or a few years before that. I wasn't aware. That's the main driver. And so they can pressure me. There was one could check here because you probably be okay as far as they are concerned. And we are there more any possible until unfortunately stroke be happening.
Okay, that's good. Dr. Yenka COVID was my first question to you is how did you navigate through COVID? What was your experience from a professional perspective and also from a personal perspective?
Well, I mean, COVID, it has been very challenging for him now, for professional perspective, because you have to find a way of working quite almost immediately. Which wasn't easy. A lot of patients are, you concerned about. Some patients we sent to hospital who unfortunately died. There's a lot of patients who are very unsure, worried. Some patients who are not coming to see us or were not coming to see us because they were worried about COVID, and then of course missing diabetes and hypertension, people getting strokes and heart attacks because they're not having the normal monitoring that they should have. It's been challenging in many ways. And then, of course, the vaccines came, and we have to organize and give the vaccines from centers that the parties were working together to establish, which took a lot of time and effort. Meant that, you have to do that and still do your normal job with patients, all that. Again, that was very challenging. Thankfully, now we are almost at the end of until the winter booster comes in. So it's been quite challenging on that front. I mean, personally, yes, it's been difficult again. I mean, I had COVID with my wife in December over Christmas, so I was down for about 2 weeks. Again, it was very difficult, but thankfully we pulled through. It's been tough. Of course, we've had the vaccines afterwards, and hopefully that protects us going into the future.
Doctor, also when your wife, when you have COVID in December, how did you contract that?
Yeah, I'm not entirely sure. Of course, the obvious would be from words, but it's difficult to use that in these things.
I see. Hey, someone to tell me more. This whole COVID vaccines, and then people almost say ngobi. Until that's their right. So what are your views about that? And quickly about the vaccine, and also say obi what underlying medical way. What are some of those medical way? It's me Emma COVID. It could be now obi there or survive.
Yes, I mean it started from the first question there. I think so. Yes. I mean, the law says for right to have a vaccine or not. I would strongly recommend people to have the vaccine because it has shown it's quite effective, at least at preventing the serious illness and of course the death as well. So quite important to have the vaccine. Now, in terms of the underlying medical problems, it tends mainly because there are certain diseases when you have it impacts on the immune system. It restricts your ability to mount an effective immune response to the virus and help to get rid of it. And of course, the main ones are diabetes, things like kidney disease, heart disease, even like strokes, asthma and all that. Asthma and all that means that because your lungs already have an issue, then it means the disease can take hold much easier. But in terms of diabetes and these other diseases, it means that your immune system is not able to respond effectively when you get the virus. And those are the main ones that would mean that you are at higher risk of complications from getting COVID.
Doctor, why are there I'm say may na wrap it up with you. Now how about your money, your young people? No? How does this COVID and the vaccine and everything impact on them? Are they at some point going to be offered vaccines or now?
I think so. I mean, because there are a few studies I think in the US and here about younger people having it. At the moment, over 16 can have it. If they are from 16 to 18, if they are in the higher risk group of, let's say, people with severe asthma or things like that, or other diseases that increase their risk. Thankfully, COVID in Nkrano hasn't been that much of an issue at all in terms of Omuankasa getting very ill from it. But then, of course, the Omuakasa pass on to the older people, then it is a big factor. And I think for Nkrano, the main issue has been more disruption to more education, more socializing, and for the impact on their mental health and idea. But going forward, we'll see what the studies report, whether there's good sort of evidence of effectiveness in NCRA, and then of course we also have to think about the wider risk or the wider implications from the vaccine itself in NCRA, especially if they are not getting very ill when they get COVID itself. These are all things that we have to really think carefully about before we say NCRA can have.
Okay, that's beautiful. Dr. Emmanuel Akofu saying with some question, Mano, see, I had blood pressure after I had a thyroid surgery. Nana, please ask for me if it's possible for one to get high blood pressure after thyroid surgery.
So I suppose it depends on the thyroid surgery now. Or if you have hyperthyroidism, which is where you have an overactive thyroid gland, that can lead to hypertension. If your thyroid is underactive, then that shouldn't be a risk factor for hypertension. But certainly, overactive thyroid, what we call hyperthyroidism, can contribute to hypertension. But I mean, in all fairness, certainly in the area, that maybe as a kidney disease may cause hypertension, quite rare. The majority of the hypertension is influenced by lifestyle and other risk factors.
Okay, what I said, doctor. Now, doctor, I'm saying I had a young come on health, no per se, ni besi. Ye then ya say at least ye now in the network. I'm hoping at some point and ye have be wa obesign Abba. And I'm a doctor.
Oh yes. Anything that we can do to impart the knowledge or expertise or anything we can do to help our people, I think it is well worth our time and effort.
That's good, doctor. I know so unyini Ghana, you went to Akatichie and you trained before coming here. Do you put that question? What are the values of Ghana and Ukusu holding on to El Gromha?
I think that the main is the sense of community and being there for one another. I think Gromha, the society is much more sort of individualistic and is what you and a very close family unit can do for yourself. But we know back home, it's the focus more on the community and the wider family. And I think holding on to that helps, because then you feel more obliged or more willing to reach out and help others if you're in a position to be able to help.
Okay, that's good. Now, doctor, with self-care, do you do any self-care? What do you do for self-care? Because I know doctors, you can be busy sometimes, especially our family as well. So how do you take care of your well-being?
Oh, you mean as my personal?
Yes, one kasau.
I mean, I do regular exercise, so I try to practice what I preach. At least 4 or 5 days a week, I do exercise. I used to go to the gym since the pandemic I stopped, but I go around my neighborhood, at least walk for 45 minutes an hour, and then of course play with the kids, meet up with friends sometimes, and go on trips and things with the family. Yeah, just try to mix it up.
That's good. Do you watch football sometimes, doctor?
Yes. I cannot say that it's relatively being a national supporter. It's probably the opposite.
And now then I'll say AC and you may.
When they say England also, I think England will win too, and I'm hoping for it, and I'm sure they can do it.
Do you believe we can do it? Do you believe it's coming home?
Yes, I mean, I think we have the players to do it, and as long as they go out there with confidence, it will go right.
Okay, so obedi question about Auntie Francesca Boacho. Nana, please ask the doctor, what is fibromyalgia? Manka weduniya fashion one. I'm media human resources, and any advice he can give on now.
So fibromyalgia, yes, my friend of chronic fatigue syndrome, and that's a myalgic encephalopathy. It's a relatively newer condition is being recognized now. You should answer clearly what brings it on, but as it says, it's chronic fatigue syndrome, that you're chronically very tired, you get aches and pains, most parts of the body, any little activity really drains you out completely. There are a lot of studies going on to try and find out exactly what is the trigger for it. Because of the way it is now, there isn't one single treatment for it. combination of different things. Eat the diet, exercise. You can have some medication to help with the aches and pains, and sometimes even psychological therapy to help you to cope better with this. So we call it a multidisciplinary approach to managing fibromyalgia. But in terms of what actually is the trigger for it, no, it's not still very clear. Some people have thought there's some viral illnesses triggering it, but the definite cause answer.
Okay, to be then I did control it. And how does one get diagnosed of this fibromyalgia?
So and the diagnosis is done through the surgery or the hospital. You normally will be like the patients will complain, almost really extremely tired and lethargic, or the day, and then they feel washed out for a few days after. It takes them a long time to recover. They have aches and pains all over the body. Mm-hmm. Sometimes tenderness when you touch the body near there. They generally feel very drained, can't really cope, and then you do investigations, and because, like I said, you need the exact cause of it now. So we do investigations to rule out other possible causes, and quite a wide range of investigations to make sure that there isn't anything else to explain for the symptoms. And once you rule out everything else, then you would diagnose it as fibromyalgia or chronic fatigue syndrome. Mm-hmm. And then the treatment, it mainly depends on what are the main things that are bothering the person the most. It's mainly aches and pains, and you can have some medication, you can have physio. It's more tiredness, and you have to have modifications to do their work and home. I think the approach is more difficult. It depends on the adequate hand panel out of the thing.
That's beautiful. Thank you, Doctor. Auntie, sir. I wrap it up, Nisa. And I wanted to do that because as a general practitioner, or a broader scope of areas I'll look after. But as we go down, during the course of the year, you're narrowing it down, you're delving deeper into specific area. But for now, Bibi Ohio so catchray na Bibi Ohio dream say be a very crucial man busa, but say community no eti and
I think so. I mean, generally though, with that we have to take care of ourselves. We have to take the initiative and look after ourselves better. So I'm not sure I know just the okay at least they kind of would be 40 and above. Yeah, once a year. The quick checkup, a free checkup, easily available. We just book an appointment to go and have a checkup. Quite important. Check your pressure or sugar and your DSR. And once you're doing that, then the review how you see it, and then you're motivated to tackle it, and we can do that together. I think so. We just have to be more proactive in looking after ourselves and going for help.
Doctor, sir, questions about Kamiyeja or Kanawe de Yenya Head, Mr. Wa answer Mommy why. The first one in is, are you aware of any future side effect of the COVID vaccines? No, Anna.
Well, I think the future side effects, of course, that is difficult to predict because a relatively newer vaccine. Now, for now, we are aware of quite a lot of side effects that are unique now, which are generally, you have the immediate ones like the aches and pains, the fever, and all of those things like lymph node enlargement. And you have slightly more delayed ones like myocarditis, and sometimes it's unfortunate people having clotting identity. There's quite a lot we know, but into the future, it's difficult to say. I mean, generally, vaccines that have come before, side effects tend to appear usually within 3 months, 6 months, usually at the most. And I think that we hope that by now, we generally have seen the side effects that can come. But of course, in science, you cannot say never until you go through it. We have to keep an open mind and monitor the patients who have vaccines.
Okay, doctor. Obiaba line so I'm so the question. Hello.
Hello.
Hi, me pacho wine wo hey.
Shamba Nekase.
Oh, Uncle Shamba, me pacho boko dear.
Maybe I will be able to everything is good. Yeah. It's a little East London. You're cool.
Okay, Uncle Shamba, Dr. Oppong our line, so what question be a health related question?
Yeah. You have one question, a man in Tina, my friend, we say. Now, me so far, I may take a program for some time. Now, or can be say, a event, in the Anibu or a funny thing. So, dear, I remember when you say high blood pressure, a funny thing, and it strokes in on my number. Now, person me this one is there. A devil Indiana, Ghana, Ghana Indian, Ben, say, Nipa, I say, would you have been low cholesterol? Say, Emma, a funny thing. Unya say, high blood pressure, the phone say Ghana, Indian, a funny thing, a heavy, and no, can be this say, most of the Indian and a static food, and high say static food and very, very rich, whatever. You know, say Ghana and Indian and you good say a bit media. It is a you and build up weight, high blood, high blood pressure, and and I'm so with me. Am I some friends? I threw some light be on it now. It's usually be
Uncle Shamba, why the doctor answer now because I know being so sending me that same question into it's interesting. I'll see him was I say a journey paying you better me because as a Ghana you're limited to either bayure and as rice, sometimes 5 days a week. Into them say and need Uncle Shamba question here, Papa Benti. Dr. Oppong, over to you. What do you think?
No, I mean, I think that we have to look at it slightly differently. So, and you know, if you are only had to play when you put your for phone only by any right, no, and no one part because the amount of energy for your daily activity. And it that's again the crowd, but suddenly high again. The would okay, we don't know who the rice and it's true. Now, also make sure that rice, no. O plate no hair rice no 1/3 na 1/3 no what you chow so why stew nyadua ni kontomre ni ade na no 1/3 na so fish na say chicken skinless and say 1/3 and no stand na you can say because if you are on a party play but initial carbohydrates no more than 1/3 because then excess calories no ever stored as fat and cholesterol near the side. And you also make sure that carbohydrates no 1/3. And you say who the fufu no 1/3 of the annual will now in that. You no 1/3 and quino more and now no 1/3. And if you look at it that way, then you are able to control the weight and then of course also the sugar and all of that. Okay, if you are now would be a pressure couple, I think that is the wrong way of looking at it because if you are not being having more pressure couple, all about controlling the portions and mainly the highest risk is with the carbohydrates, making sure that the carbohydrate what is so to only 1/3 of a January 89.
So, Dr. Bimunso Kasa instead of white rice, and you can use brown rice because I know carb near less, and I say you cry name.
Yeah.
Yes, sir. Uncle Shamba.
Me see, this doctor man say.
Doctor was into car direct into throw it at him or to him directly, Uncle Shamba.
You okay? And the doctor, we should try to answer, Mammy say. Maybe I would give fufu, say 1 pot of a fufu, and namone, fish and namone, whatever, and no. Would we are no calories, say, it's in your sim because. As I know, you see them man, I say every day they are 1,500 calories. And then mass year, 800, and I say 1,000. No calories for food, no different for her. Calories been out, send out with me, open your simoya, it is the end too high, and I say too much.
Okay, and I think that no, but actually an adult, an average adult, about 2,500 calories a day. So you'll be about 2,500. So you'll be up to 2 weights. Then also more calories in about from for about 1,500 to 2,000 because you want your weight to come down. Now, fufuno, who is it? Of course, depending on mixture out here. So the Nana Apraku Oppong, we say Brodier. So they know low, very big glycemic index. Brodier no low glycemic index than white rice.
Okay.
Because sugars, in the body, it breaks down sugars, quickly. Sugars here release quickly for rice, white rice, not than Brodier, And you would offer the same amount of Brodier, the same amount of white rice. The Brodier better because sugar no yet readily available in the body. Calories no cost that quickly. And you say carbohydrates, then we look at glycemic index. But I think generally a manner too complicated for most people. Who keeping it simple, easier to follow and to try and cope with it. And trying to keep it simple.
Your body is good. Your body is better since I fried rice. McDonald's,
oh, yes, correct. But I don't just far body, a whole plate and what you body, plate manually. And too much of that will also not work. And it's also we yourself, Brodier is better than rice, but who dear still so they can 1/3 of the plate near Brodier. 1/3 near or control me still near the 1/3 near or fish near the other come. And 2 years then easier to manage. Exactly. Because carbohydrates is dangerous. And you also make sure that you can control.
Okay. And me that the doctor. Why are they for answering my friends? Me questions me that say thanks. We so no bad. Why are they no me educate you or no me thank you very much for that.
You're welcome, Uncle Shamba. Ain't yenja quite na cop for now, and I will more questions.
There be no one on the say I'm okay. Me check the
Me patroti na doctor Kwame say here opinion on something, why?
Okay, all right.
Doctor Mpacho, obisa me musa question manu. Or say seizures, maybe I'll read the question. I'll say, Nana, please ask the doctor please ask the doctor that. Oh no, I've read that one. I'll say, what am I talking about? Nana, please ask the doctor what causes seizures in a person, and how does one prevent it?
A bit complicated. I mean, because seizures.
Doctor, seizures na nuni e chano wahu.
Seizure no say what top of now who check and no seizure, but causes maybe of course epilepsy the main cause where you test maybe you test different EMG which are brain test it's new types on it shows the epilepsy. But there are other causes of seizures. I mean sometimes can put seizure. Sometimes electrolyte imbalance is seizure. Sometimes fever, especially in crowds, seizure. In the seizure, the cause is not. But meaning say or refer to epilepsy, and I say just seizures in general. But seizures, the cause is not. It depends on the cause, and eventually the treatment crowd also the amount.
It's the reason an ideal way to prevent seizures then until you know the cause of it.
Yes, it depends on the cause. So the cause is not also. And your cause of it and eventually what you can do to prevent it.
Oh, because I know sometimes if people to make fat enhancement or recreational drugs or something, and it causes them to have seizures. Maybe one of being so epilepsy and so it's maybe into a different so epilepsy now we are bound or prone to seizures. And it is how you who she are into me doctor.
Which guy who say of course there's medication to treat it, but apart from that medication also there are things that you can do. One again, making sure you're well hydrated all the time, avoiding stresses because not sleeping well, getting stressed, may trigger seizures, if you have epilepsy. and into making sure that you sleep well, you don't put too much stress on yourself, you exercise, and even crampo, even work a diet crampo, some diet changes that need to come serious. There's lots of things that you can do as an individual apart from the medication that you need to do.
Okay, I'll say on your seizures after on your stroke, Into a possible so to me suffer from it when you're recovering from stroke or when you've had stroke.
Oh yeah, so stroke, a brain disease, and you can get seizures from stroke. And not happy now. We will put you on medication, and as well as control your blood pressure, and you put you on the medication specifically to prevent the seizures. And then generally, you do. Instead, you kind about hypertension in your manner, you do all of that, and then you take your medication to prevent the seizure as well.
That's beautiful. And to Dr. MC, I will wrap it up. Nampacho, I asked about your highs and lows of being a doctor. What are the best bits about being a doctor? And what are the challenges or the worst bits of your role or your job?
It's difficult to pin it down to specifics because there's so many beautiful things in being a doctor. I mean, I think that maybe to summarize all of the benefits, I think that just being there for patients and maybe seeing that you are making a positive impact in whatever challenge they're facing. I think that kind of satisfaction you get from that, I think that probably is the crux of the highs of it. The lows, of course, is when sometimes you feel completely helpless, and you because there's some conditions that unfortunately, even as at now, medical science cannot fix, and you feel so helpless when you cannot do something to help them. Yeah.
Dr. Mate Asepa, I think this is it for now anyway. The next time we get you on, I want us to explore the cancers, that will probably be our next topic. What causes cancers in men and women? But that will be next time. Before I lay you off, Dr. Awutie Ghana News now.
No, occasionally, not much. Again, I try to prevent Ghana media-induced hypertension in myself.
I like that. I was going to ask you a question about how you feel about presidents' wives being given some money or salary. I know you're a general, what are your views? I mean, you live in England. That's Boris Johnson's partner get paid or something. What do you think? That is what was trending last week in Ghana.
Yeah, as a general principle, I don't think that is right. If the former president there has to be some provision in the system to cater for them. But I think that just paying them salaries as an ongoing thing, I don't think so. That's my opinion.
Dr. Yatit, the absolute last question, Abifi Freddie Kwesi Ejehosi, can I ask Doctor his views on local medicine, such as taking dandelion and the likes of that? So people said earlier on, but Doctor Uka say biayana Uka bibi say into me active substance name as if for what it's like. But what are your views as a whole about traditional we say be business so below, but in the brothel in procure the same any dandelion and all of that, and Dr. Ojim was saying.
Yeah, I mean, because earlier we were talking about herbal preparations, which a lot of them they don't really say what ingredients. But I mean, this is slightly different in terms of, let's say, this will come under supplements. The hibiscus, dandelion, precasenia, they will come under supplements. Now, some of them have good evidence that as part of a healthy lifestyle or healthy diet, it does help. So let's say things like pomegranate for people who have prostate cancer, there's a little bit of evidence that as part of a healthy lifestyle and diet changes, it's helpful. But ultimately, I said, no, we'll rely on your treatment, because that will not work. You do that as part of the lifestyle package that you made, and then it has a little bit of evidence to say that it can help.
Okay, to recently so to me the hibiscus flower with ginger and spices and everything. Or no any pineapple it helps. It builds all the dandelion effort so and also to me boy. So you think you're saying say a supplement. So even if you're going to do it, you have to do it with good lifestyle changes and so. And yes, I know on its own, doctor.
Exactly, yes. And yes, I know on its own. Hypertension now that we are just on Percocet. It helps. You just drink Percocet day and night, and just hoping that will cure you. Because that will be a bit silly. You have to make the changes in your diet, in your exercise, and all this, and then do that as well. And then together, and then it can also have a bit of an impact.
The absolute last question. I know I've said that before, doctor. Thank you. You'll be saying, I didn't know salad is good for you, all of these leaves. And then Ghanaian salad, you're mixing with baked beans and eggs and mayonnaise and all that, And also, so what health implications need to be added my.
Well, I mean, of course, salad is good. We're talking about the vegetables. And she said to me, the idea is not to have baked beans as part of it, because it's your vegetable intake that we want to increase. But of course, we know some people do that because they want to make it rich near their guests, which it's not necessary. But I mean, I don't think they criticize it too much. The main thing is to increase the vegetable intake. And if occasionally somebody wants to do that, that's all right. But the main thing is more vegetables and less of the carbohydrates.
Doctor, yeah, that's it. I'm running into a honey do bit. So people start a question about water. I didn't quite catch it. See, ask the doctor if fresh, I don't know, is it snail or fresh still water is good for preventing stroke and high blood pressure. So word be SNILE, but that's the word that came up. Emmanuel Akufo question. Lawyer, I mean, doctor, what time are they better answer na for yenda was say na fell back next time.
Water intake, a good idea that as an adult you aim for your 2.5 liters a day of water, because that helps with your kidneys working well, flushing out the things that you need to flush out, and it helps generally the body's metabolism, because of course you have to remember that your body is 70% water, and water intake is good. Now, you cannot use water as a treatment for hypertension or diabetes, because that it cannot be. But having good hydration is part of a good, healthy lifestyle.
Thank you, Doctor. And I'm really quite tiredness, but I just really want to thank you so much. You've given me more time than I expected, and I'm grateful for that. Into Doctor, nyame inshallah ni wabuseni na why na why am I in England and winning? Amen.
Amen. No problem. You're very welcome.
All right, Doctor. Take care. Now that wife says why we'll be in touch again soon.
Sure. Bye.
Bye.
Number one champion.
Rainbow Radio,
And yo,
Africa's best station.
yeah.
Oh,
Yo,
Rainbow Radio,
radio.
Africa's best station.
Hey yo, non-stop music, we are flow. Shut to Rocco says so. Ya don't know.
Mama intie enyom baako na esia mesaya ba na watching unto so president's wife ne omo salary so way inferiority will be announced today. Now what are your thoughts on that one? Mama min ko ahoma ne say say call bi aba ansa na yento aso. Hello Pacha, why no hoi? Hey Ghana call. Hello. Hello. Hello, Asa Okasawetri. Hello. Hello. Okay, you ever say at us? Oops, there's ever say to us, I can't go out and say I do love you.
Still can't believe this. I can't believe I can't take control of myself, baby.
Hello.
Makuma bo me bang bang.
Ghana call into me engineer so.
My own corner me soon, baby. Enka, Mr. Playboy, dear. Kabani send on you, Obama, Makuma bo me bang bang bang. But this feeling is so different. What reason?
Honorable Samuel, I pay me chow pa me patch your friend, me name to drink come on.
Cause I wanna know you. And this really, me person me new you. Come walk it to baby. I share my society, see it. Yeah, oh my come on, Nana say I love you, baby. Wanna marry you. Live without you. Oh, you're the one, you're the only one, you're a diamond girl. I wanna be with you forever, forever, oh, forever, forever, forever. I wonder if your father was a saint, cause someone stole the stars from the sky and put them in your eyes. Girl, I'm not saying things just to flatter you, but every bit of what I say comes from within my heart. So then send me why would you share me move if your name Manuel Popo found Sakama Kuma dressing your hair was so man can't share what my hair but to me I can't be matching me 3 points. What reason would I have given my heart if I let you go, baby? Cause I know I love you, I know I love you.
Hello.
Hello.
Oh, Kwame, it is saying.
Oh, you're good, pa. It's a better no.
I say, you're good to say day.
Better.
You're good to say better. I'm in Paul. Hello.
Oh, you are Kata.
I'm in Paul. I'm say Ghana call Biaba. So hold on for a sec, man. One patch on me, but hello.
All right.
Hello. Hello. Kwame me being called. I'm say honorable Samuel I pay for every Ghana, but me honey number, but into me engine as into Kwame Kasamaye.
Okay. Nana Apraku.
Oh, me just saw Jina saw. Well, how do we respond? Yeah, Joe me bois.
Yeah. I'm just
And you know me Joe Vermena. If I show Denmark, I had to say.
Denmark, you're fine. Oh, friend, the man, I'm in Trappon.
And then I'm in some cabby of Vermena now, Brimpong. Or can cabby. And you can cabby or can cabby. Kwame me being called. I'm saying Ghana for 2 person will frame it.
Yeah, the Chagana food now, Chagana Marty to you don't want it. My home farmer, but I'm a woman and mate. That Emma, then I'm one here there, then clearance among phobia. Then I'm a secret. And then you're consuming the Kuchiaka command. And I could see in Sra, our Manchester, Burma Coco, or also the Chiano. I didn't man tackle our back hiding to William Masanapla.
South Perfect, Kwame.
Okay. Now, Dr. Oppong, so the Nana Sibibre, and Secretary of the Mayano, Yapa, said the Bamaya, you bring up because also Brigiano, say a hospital. Now, your coffee fair, your Jim, the Uncle in the Uncle Subia. Oh, yeah.
Kwame, doctor said, Coco, nya, and Tua Donko. What's here?
Okokonya, I won't want
I see so heart or blood pressure and unstable. Sometimes it's an amibus. I didn't even with me heart attack when during sex or something. Now, no, I say be our blood pressure unstable. Sometimes they can cause that. It's been a media farm home.
Oh, but no correct. Oh, there are some who are there some because sadly the command generated the and so we also fresh and also a command myself. Okay, a command woman. Next, I was a command. If I said to say car and winning nowadays when will be equal race. I like our Betty over cafe. What do I say? And you know. You're not correct. And to me, man, I'm okay. I'm more heart problems, you know. More than say, who guys are them. And if I can see, and also, you're not so picture. You are a man, my family did say because a person is an alien, I couldn't do a person or destroy, no. And also, couple. Oh, and a drone could boost a command PR. Now, if you baby, it's a command. I get the Juma Manabroso, and to look at myself, or talk for a cow at the end also. And to me, my motion, we.
Why me patch mommy 1 sec, maybe. Hello, patch a wine for Figane. Honorable IEP. And Obrin Pong, yen twice away.
Yeah, and to me, my motion, we. So we could not lay our comment. I saw Colonel will be a senior idea for she's in.
Now call me at Nana Yakuna de me and Fatu Hui.
That's all now, bear me.
Me patch of you UK or Denmark. It's a studio. Oh, baby, for Freyden and me Bemosa.
I never do. We don't say, you know, you went a bit in Gruma.
Sa for pet. Yankasa comment.
Name got food for the young Fatu Honakoya as a wabrame.
So, Bemena, my being called.
Now, the teacher, I'm afraid, it's a man penny a year Akatia. Oh, I deal with say no. Then I'm patcho just give me a second, maybe.
Me patcho you. I mean, in the meantime, Miss Agana call you before. Hello.
Okay.
Hello.
And got the Amasama.
And yes, I'm Brian. So, Honorable IEP, I can see his number, but for some reason it's not connected for him. I cross up on so airfare, but Kwame Yanka send me answer. And yes, I crab a book out for Ghana.
Okay. I mean, my Brian Casa.
And to Kwame Ujajina, so why? Hello. I know you're Brian told to me, so I cross up on.
Yeah.
I cry to say. Good. Yeah, tea when you were hard chair.
Aye.
Oh, poor to say, I cry. Good. And penny for saying him, see you beside had your bro, one hour numb.
Don't I make us an enemy? Your mamma come to small dear.
Ah, thank you. And what you're here now, cry told to my pencil cabby boasso, and I will come once up.
Better and then I never madame to be Casa. Was a normal court and dreadful comments at a that's only part. No more one person do many. It's humility, but now we are wolf of fool. Now, no more to come. I have been them. And what I need to go near Salmon. Chakra. Then go to Muji, and he said, "Oh, Queen." The only be a fool. Then we'll move crying. And then for no more going. But what do you mean?
Yet, Papa, and nam name, coin and what I need no him say, him say a deal, Musho, but now a proud.
And you do well. If don't want to know what then we'll move crying. Move here. Which microphone, hypertension, and diabetes, and the street to kidney problems. It was it. Yari move a Cassiano, and you declare him, and then and a desire the Iba. It did, and number repeat, and yet, and more.
and teaching one year. Fruits really vegetables, Muana or stew, and now the account which you rather if you remove into a division and a mouth. How more than pack. This one year part that is a wow, did you? And just a butter.
I see, I cry that say. Until I'm say telling a doctor they can say a 30% of a janina should be only 30% they say a carbohydrate, and that's something we'll be on here now he put the plate ma with rice. Maybe I still kitty be na a gun chain. Nini na no MYA. Sana also hona crack.
Nanny. And look at a load plate no out here to cry wound and this will dick a cranzana. As well can have a form.
And you're right, since one day a bitier and I say, you know, a bridge and ya yakana for 4 Nini na and say too much carbohydrate MYA.
And they are perceiving well loaded. The only body who did beer as auto party. It's a weedy deal.
I cry why dear. Now then be on a coso Ghana. I didn't know yet to tea what I mean I'm not metete. Say I say president you nominally have a more salary or something. What would you know say? Doctor de Mugusan and was think about Uncle Neo Monya. What are your thoughts?
Oh, say no more canon dear. Basically, let me si Canada Dawson. The media come out to Munchagura. If you know how much be paying, and so you buy almost you was in chance on the SS and form who cry only and yet the so more ye, Bosun be a Yatimamo. No more aji. Omuncham Kura, president in the country and Sunibia, and Yai.
Now, I cry puts into question teachers, you know, civilians, you know, maybe what you me or mommy a teacher. I have to survive on my salary. Oh, yeah, prime minister, or president, I am funny, sir. Or salary, you know, more than the ordinary civilian. I didn't I want to mean take care of your family from it. Now, with you know, I was here, man, whether it's NPP or NDC, you know. I cry with Jane Hussein. Let's be fair here.
You say, but you fall on your baby or home fan of what? You may be your woman, Yanokwa. Oh, electricity muntia, is muntia, more car, driver, petrol, the goon mamma, security movie, my Ben will be a near mamma, and Tessia de Gimoso. And so more sounds of Sabbath you in so I can hold there, saying the movie of Basia. It's a 2 o'clock train here to the second woman trip. Unia and soon be a jay. Already crown presidents need to be a while on some. Omo Akuri. Even Gigi Sika at the talk or near Mamma Ghana, it is all my boy a cat. We Chimu say Yasika. No more I sound so teaching Scassia, they are saying any anchor.
Accra made us say, say, Obia taxi about Doctor Aqua wait me, and no so apart from say, Jan quantity in us for an embryo, I did it in so count late eating, peanuts, no. I am why Accra who of you be on that now.
The correct or say that down for back we see. No, or your Juma pa on so pabon TD. It will be fear not the answer, no ability. Then be over the baby, not the answer, no ability. And as they say, a man or so tell what I hope. In Kuno, there's a wire out of 4. It will be on 9 or no, did what did you in Nafi? The other thing I own, Webima. Who did you no? What did you and Grand order? Sadi Moa. Yes, what we did so.
That's good. I cry Auntie Maggie Sochia, Margaret Thatcher, so bet you and so on me. Amazing Grace, your co-founder, no.
Auntie Maggie, and as a papa, Benjamin Shira. On shells on your case, see, someone is a dean in a remu. That's it.
Amen. It's Accra final words behind near Cobrin Ponso.
Oh, the mommy, and not so. Oh, there was a branch be. What you saw here, you must also be scar at the Sidam and Mammy. To a year, Juma San, I can go to Africa doing a big free, but I want another. inu ye ye ke da ya se si ke she ho no mo boa ha no se mo nyin kontra petition ra ne no man
sir
so if you bet me ya djuma sa no fa mu awu iti home enso so ya di ehia o ye djuma jiwa home uli bo so akọ na ka so o ye djuma sika we be ya ebeku sika no ho
na nkofo na edi sika na ma o me bo na edi bi ato adaka
ya edi ato adaka bi ato tonsa ni anu mo ama o na oko di home o ye djuma home o di ntem se o mpon ntem no di ane ko ebo be de no na ya no mu anu odidi anajo odidi no se kum ni ba
ayo Accra na football England ne Italy o support him for ansa na meja kwan
o me cha o him an group wo ti England go be win
amen JJ na they can as when him said they're competent enough to win
me sha ti se Abranche kitikiti ya obo right away
I Sterling now
Sterling le ho ahomete ba o ya 18 on ho kan no anu atop on penalty ni aji udi agozo a obehyewo eti Italy for no defense they are strong no doubt about that na no so hwe ya won dia branch e bia to ani ho wo mirika dia no wa bobo no tintin na wa two mirika sa mo no akobwa hye nti ani say so mo yire no wa kire ho no a o mo ntimi nya hwe
Accra minimsa na ubo football pa were you a goalkeeper now so now you're a player and kasa what did you do and it's a opportunity to coach the English team I football now the mom
ona me goalkeeper training college ni na me ana na me football ni hockey ni na me two regards so ba me nsamu buri ana me jai na me bo ya ko bo second division e won Brazil nti bo ni minimu omo nyire won omo ni mre defense no nye tight carry na ni move for no so bo one shot this is the very new move for the shot so if you chire for to bia nyere no ho nti enkwa wie no na England dey nkuni
amen Accra that's it enti e do besi ha emre ni nti
all right
take care why you be ka say trade
yo
bye mo ma min ko Denmark na min ko Obrimpon ho kwame wo so acha Obrimpon I'm say be sai afre Obrimpon enti mo ma yentoa ai ya godie so
Still can't believe this. I can't believe I can't take control of myself, baby.
Hello.
Hey, Obaya.
Yes, sir.
And I make us a branch. I make us a Yana and I'm a lie that I've a freak you to say.
Oh, yanti, but Ogusuti ain't in your baby a catcher or very responding.
Mechia, and I know kind of one of my
Ami, and I wear.
Yeah, not here.
Up here. Oh, I mean, check here. There is an honorable so hello. I'm so honorable. I pay the line in hand and to come with the may ignore and now casa mommy. Why?
Okay. Nana, your mommy, a throw to you, what's the more to you? Say, Embrano, and not dear Nanato, and the air say, the young one year Janica. Oh, say, politicians. What were your hypocrites? Oh, why am I not what you say? Nanato, anybody will be on the CM child, or more Moka. But media mediate mu and assassin will say one more possible and preppy or parliament one hold. Say see a buy and one more 10 BBS and another more the piano Eureka. That's it. Ghana phone now, you better. Monsha, Nana Apraku. I said, Ghana, when you could be a dear, be when in the gym or talk out away or sit down my way. But the question is a sense, I ain't one year 3 years. Or 4 years, also by yes, at a mouse, dear, now who the row be old prayer. No, yes, now who dear, now so you be with your man. I got my hammer so by it, the year, ambulance, no, I come away, no, I sit that way, no, you say. Nana go so by a sign and a year. The question is, says he can hear from woman yesterday. Moment a woman could be free, a buy mupe. That's how the man in our water. Wait, let's say down the Ticano. And I get some woman. And now hypocrisy, what am I your phone, you know? And no more, I know the year day, no, the year, Sanya Mana was there all more yellow. And who here, mum, and yes, be a yadigen jabby. A yabia who here. Now, my question is, say, I hear some woman yes, cannot, and my woman. And didn't any say a per se. So, mining in a year per se. A man penny 4 years, a year be dinner, this come a woman. Yet to me, question as an office. Now, young Musa Yama woman budget to say, what do men ye, what do men ye? Now, Ochina, what to me about the book, no contact, when you debut, Yabi, Yabi, table, I say, who are Joko, who are way, who are you, and to the amendment, and I'm not it. Yes, it be a
say ho, over to pay.
Oh, yes, it be a Ghana, a Kunja Gumo. Some control a some man now, a woman play, the first ladies and the second ladies, no. Woman, a car, woman, woman, and Yakatua. But will be able to mean check a woman because a woman, you may be like a ton of walk on that. And the Ghana for a bet to me, Sanya, a Yakapo Kai. I bet me a card in the young Trump. Who could your president or could there be a Abrosa where I was to Kawansa? No more stressful. No more Ojina, what can be a better? Because me who said Germany, Italy, France, and hey,
UK. Come if I UK come home.
I got sham the account home.
Me father mini akosia o Manchester. Kwame.
Okay, my oh, me who that I'm penny for almost you know, baby said, yes, say that. I did Ghana. And it's a better media. Yama Womo office. So a man young neighbor to a Yama Womo office. You won't say the Caprama Womo. No one the year be a chair, you have to be no more trusted. Near Bumwa Conte. Sanya Kada for the Alcoidia. Politicians who are more near only a hypocrite. Only you'll be a gun of crap. Sabayan and MDs in a Washington, one of them ran away by and 10 people before they had the same thing. They say MPP, MDs also got the same thing. And they say to me in creative office. I bet me I hold one more accountable there. And yet, Yankam Mukra.
But Kwame near me and he says, Asika and now one crop for Jidada. I feign I be musa any, so Mujin is Sumasi and a young famra, a high Munayan Tronian document in any part of the constitution. The Adentina, President Abe Trumnio Momos, you know, my who said Africa is a continent I struggle financially. Then, you know, and ye necessary sell Mujire no mono. You bet you Kamati be because yes, back date 2017. What do you know, say?
Me, Sadino, hole.
Me honorable I pay pana Matthew no so no mas mo no so parliament oba Kwame Kasame enko.
Na de no hole. Na one money na politicians and them hypocrisy into no one to make an here no. What you say? And I'm because a honor almost the shower box no. Because it's an MPP and NDC to Chicago command full soldiers. Almost the Chicago office first lady office. And one more time one more continue one more betting one more the acquired one more pen. And then politicians one more person one more system and society, you know. I said no there I won't want no.
Eh very sad though. Africa Brenna Gatters my fine be the corridor wona. Oh, like a bit to school them and to them there, baby quite bridge crying how to cross the small lake or river that's there. Me boy.
Yes. Yeah, I said no. And he said, one woman who said, so one woman is aquana, one woman yes, he can yell for opium and quoting any one more pet. And to one about fight against it. And to me, a bet to me, said you the whole world, who go to say, President, you're not going away. President, you're not going away. Yes, the young child, this don't time. President, you, one you. When you say, yeah, said you couldn't call a be what in a chair, okay. Said you couldn't and ask for banners who was got. Let's say, what the best one go phobia, okay, because me will the entire may a better mentia say. President, you are better, so Penana, you are a millionaire watching China. Here and there. When you're free supernet, you know, and one know you when you're being. When it's that, she cannot do to an hour, one with the sound of one with the eye of the home open. If the young come, and now I say, your person won't try young some ram and tone, and your clear, I'm one more black on that travel mine. They said, yes, you go there, and yet, Dana for mommy, I'm sorry. Yeah, mommy, she's to be, and Nana. And I walk a set. Or present your piano, Yereka, and never Umina Neka, Chasabra, Wamusha, a bad woman, I'm a Penibia, or Baba Dana Puyaso. And then another, and the politicians, someone addresses our issue, especially and this is war. Moncan ye, Namunya said, one after four, and then this is one for me, Pamcho. Politicians, Yamaya for, and you decide the year. No, I call them, no, I kick up. One more draw at home. And when they say they are more defended, more training.
Master Kwame Sane, Tekwana Nana who said, I saw one casa to me chamo because it's just really bad. It has to take one decent person to say that Sam Rano, a hoda dada, but my baby, and ya M1 mining to your bitchum. I don't can you bad. And I said, some person here, man, come on, job description. Write up a job for them. Oh, major many. You bet me out the tea, or bet me a boom conta my and only any money asap. And I know that they say one of us, one more year. If you are telling me, said another one, the person will carry a year. So what you are saying? And said, okay, can you play? I don't know. Yeah, pretty officer, my woman. And you tomorrow, I'm going to Yama, what I could, what couldn't I go and say, the black contact, me the way away, okay, and no, I don't know. But and I'm some politicians, one woman says, Yami, Sisubi, all women says, the young rat, now yet we control one more. All moon to me, where to come for hope him. That is politics. Almost I hear Carl Lonson, so I don't see another long conversation, me boy. If I told you, me say almost hear Carl Lonson, and so I don't see another long conversation, me boy. Woman, minimum, Kakra Maxi, and also no. You say almost, as you say, I mean, no, we are Duma, ye be at Nipa Mass at 10, and a year Duma, and ye come on what you long. Now you better talk, and I see a Kotofi near the Akiti. Said the American on the side of the and Caboni being society via Stadium and Trimuka Cabin and society via Caboni being. Nemo, your bar politicians here, and now say, been to me or more
enkyere nyema mu ye enkyere na kwa ya say hey politicians no yeah abanye so okwaje besia mo wo mo akotoka ampaka ne de ebi abanye ne begina besia nanim asai nyemo wo mo ne betua simple and yeah so education on politics no so poor eba ya ni akotikan basa na sam no you say no na
Doctor say on person dey Ghana press beka no into reducing the blood pressure so up away into on time take Ghana news o te ho no
mete ba doctor mesra no one more won nim die sense no ye because Ghana no akoye bibi e wo ho no yani ayantumi anko school anko chira ye esiwoso ni ade Ghana won ka bro fitra je so ni yansa ama oman no ayese obi ama na no so anu akasem bia pupum ti doctor mesra mo modawro ma wo nim die aya amumwa ye ampase bia ukomu aya atemdidie ni nsem funu bi ndino ya on va so do ho kwa kwa frefrem ba ya sere mo mamu nya ya jeje mu sa da ya densuo mo anso ye mu ensuo de ebeko ya sere mo penifo amu wa brochire nyina mo amunimu de akwachire mo amunimu numa bi mu mo Ghana na se Ghana sai ya sai ma ye nyina ye so ye nyina bia enti mo ka se mo fa ho ampa na politics ne bufu babu maye ni de mo akakra maye na ye mo de ye tumi nka o ka kura te say o de pani e wo so ata so
I want to cry me boy
yeah want it media de na me ye fa na te da o mo say we are put ready our time down
there been comfort tight here panti kwame say yes 30th of July London phobia come one bomb some year demonstration yes say fix the country Ojin say omo reason to demonstrate omo demonstration or proposed or whatever no justifiable ana
no it just fix the country no me the current government another party or what no so you can't fix the country me me jutum but so you must fix the country now and then another MP another politicians who want to fix you. We are all involved. We are all involved. We are all involved. And the moment young green say politicians go on what's one fix your mind.
But Kwame, omo now say shame run and now mo make sure say run yes, my so boom run so you do funny quiet. And say run so omo ya one rule for Peter and another rule for Paul said yeah say the run and koye and am boa.
Emrano enko ye no eno no chesa yanso enipa bebre no yan fix your mind no and I say fix your plan attack you say you see and I cry you free moon akoto district akoto region akoto kai national.
You see what I'm thinking is Kwame, mommy play devil's advocate here. Here fairy godmother to tell you sir we are president or ex or current or whatever. Ujisika kesia sin a civilian or a teacher so obi okompo na teacher na kwa na disu akwa enim kwa sin wa we so ti akonya so eye den na yen san fasika enkoma excess so what asio na teacher need the only the salary however million whatever ye now no amfa kwhwe ni yiri na ebia ni mba 6 na wa wo oman mu a wudi sika emu eje yen san ma mo dwenum so sika nka ho on say eye sisisam
ayabufu sem ana me kire say Sade no ato da ho no mudada do.
Ene na ntwam. Na maye hu so no aba wo ye different into one mo aso o twam ni yiri beki kran so wonya sika ni bi. Ba wo mi ayiri onya bebu nkwa se ba wo mo ani yiri no eye bebre ano je am se jama ye nim kwa me me boa.
The yiri yo bebre ano no mfa ho.
O mani bre no kwa me.
I'm not okay. Maybe I should have a young married, so maybe I'm not going to do our family in Siena. Don't go with the mayor. Hello, yeah.
Ayo, Kwame, obiso ni say me NPP, but me kasa me shada nye NPP. I think so because of me starting radio career was sources now. Sources here predominantly MPP. And I think naturally, it seemed like me a neutral. I'll go to side omu de papa. Kwame unim be yadri and I saw him in yadri.
Yeah.
I wouldn't say some NPP, meaning some family members there will be NPP, but I don't know enough about signing money to say some side with left or right. But Basina was send me a papa, you best support you, and your papa and so I will say you can and so
yeah, and the crown I can make some of Ghana say, now yeah, to a banda, that's why I'm NPP. But no try to NPP in service, you will be jamming in the future, I mean, that's one NPP, I won't go. So I asked Dimitri, I said, MPP 4 year be na ya yanka, MPP 4 year be na ya yanka, otherwise. Then you say, yeah, MPP, to your baby, are you okay? And you think your baby, are you okay? You're wrong.
I'm say for Nigeria, my boss was say once rivers are very clear and nice, and they say I don't need to say Milo. And no crying can't once, Musi emphasis come my yerenum, yem backdating co 2017. Actually, sir, it's a cafono munya riches, I name here for an idea, Omutuntoni ma or Kwanwana come more musa. What kind of a mind is this?
Yeah, Satamno, one would be a dear. And the ministry said one way what's not our committee, not to say, young regular the broken.
Yeah, regularize and answer say, is that what you're trying to say? Elni Alnado, so come with Kumasu in Pachato, Bumicromas on the hall.
Young Dr. Tracker, young regularize. Maybe I get a penny if you have no more book. I mean, she said, I drink a sea attention. No. Oh. Because one will work with the office of the first lady, I can't put on Butra or Mano. Or Mano, you may be a challenge.
I'm for job description and Brani in I can you man be a civilian crack to me apply for that job. And it's a first lady nya winya. Your man office near man budget on for running way. I'll see it to me auditing and open work contact. That's where I stand on the matter.
No. Sanya, you're close to the president. Why you will do my sample?
Kwame, I wrap it up my raining tea. What can some people I made our say?
I something in army say. Saturday no, you better near the to no more to me a black contact or mine, and I say you too. You're the one friendly because and conform will say with politicians. Am I your four? One my home to that. And the Ghana for me, I'm sorry, and you're cool for and I say, you can not about me. You one more yesterday, and Rabba Bahona, I call on my number. Said the Abaya will be about when he said, way, there was a year. Oh, she a champion for Manuel.
And also, an audit committee could better look into it, and yeah, because conflict of interest me, but then co-president were Kofu Frokran a better mom better shame. If so, that's what they're trying to do, DNA time with you, but yes, idea, and your natures, I will say, Diom come, Sabi Antoine, cried the Umbeko, Kwame me bois.
Yeah, yes, I'm trying to get a medical. But you see, a baby, your bell audit Ghana books, mono. Some comfort our office, Nisika, after more, or beyond to me, work on the before. Why?
And one of the things I'm not happy about is that Nana Apraku, I didn't in the end to me and prosecute you, if that's the correct word. I be seen na intimate you, say, where this is why is another punch of Mamma make up politics, and I am say politics come and no anamity. Come here, no, so what you name say. I know who here first, quite sunny, I drink say a regularize, if that's the word, I renum sikano.
Yeah, Nana, and yet easy. Because one woman I kaba, I tatabi I to one woman to put back on the letters at Tatano. Yet if you are not better to be a funny and the Adina. Say, Obia, you better see, I don't know quite you, and this is what the sorry says here. Ya wouldn't be paid. Ya wouldn't. What sound for me a little down? One would say, Mammy, back on the papa, back for your man. What would bet I saw the Yamato to a girl? One would bet say, who be free.
Anyway, Kwame, you're wrapping it up. Why? You will be but you ain't good news, Kakra. They say no doctor, no, they're not kind of pie told him out of the age, man. Now, for politics, in the my blood pressure, not control. I had no Bianca send me NPP name, it's just me damn fin, Kwame.
I know a doctor in the other young man because you're a politician, or you're
home.
Yeah, and you know, young year. Yama Yadiane, any yellow, so near Yadiane, and no babua ama, and Yama up to 2 years ama fa. Aja, Yabane, Ghana, the one. Namuya, you are so young Chayani and Kogan and young Kogwa Ghana. Ghana and say, sir, you're getting a kabum kakredi, this me of Madana, so ye. Also, a job from Bonnie, Manois.
Ayo, Kwame, and you may be next to be a wintina, maybe why?
Oh, yeah, Mama, she became was at a theater.
Well, they say, Bible movie been a say man and nobody can be on another wire, and after a party double panny dick can buy and say, eh, you never would.
Can't wrong me. Okay.
All right, take care, why?
Okay, bye bye.
Bye bye, Kwame.
Moshi. Yay. Who better pop? What? The brother Simbiaba. Castro. D Black. The Razi. Sobin. Afide. Yeah, that's Hobiaba. Everybody, let's go. Menamna metete. Menamna metete. Anda seho, menamna metete, menamna metete, anda seho, beti, me branda, seho, beti, seho, beti, seho, beti, seho, I feel me flippy, me twisty, me winding, and I say me cracky. Akaila suntina, what's your shit? And I say me dynamic sagala.
Auntie Francesca watches our pesa of Ray 0208 133 4646 0208 133 4646 Rainbow Radio Studio number.
Triples to the big boy from water to sea. It be like you make dog. Shredded rap we see. We don't say you be take dog. Never mind shouting on kitchen. Why there to see? So why you for shift? Small. What you want to la them at the bench? I prove a bench one hour bench. Free to be best one bench. Versace Madusa head in a bush straight. Oh yeah. Menamna metete, menamna metete, anda seho, menamna metete, menamna metete, anda seho, beti, me branda, seho, beti, seho.
Mama Minko Fakoi, hello.
Yeah, hello. Good afternoon.
Good afternoon.
Auntie Francesca Neo.
Hello, Auntie Francesca. I'm Patrick what to say.
I'm here to me fa kwenye. Na me na wase. Send a text message. I'm at doctor and so. What lecture me near me so kakam to wase bebre. Let's have fasa kwenye na me dia chia adofu bi. Champion help. Auntie Linda and the family. And Sister Diana what to do on a switch and pa. My gay, many hours met your amazing grace, the Tewanka. Now, let out your wool. And someone non I'm a person me kaka cra.
Me Patrick can be mammy to do.
For wives, I will say your more music. To be honest with you, and Ray Bank, I'm a community society and cry your mom's cat. Say what would you to Canada do? But will be all gonna be and do one my any woman to see Krumu. And I prefer before because a soon as the idea to be anywhere with him, MP for no money, pack a clear me public and be aware of this kind of air possible. And it's a most central for so sometimes and most of come and a home problem so bag and so for the be. So I'm not sure about me. I didn't make so I didn't know what that. The be almost per se, say this is a shame can only stamp so me no to one to me and bufu pa wa so see you me come me you anyway. So what na na do no buy no or so ade we no or so twam. And the kwai bi so no. So what can so what na twam so a mo amu ni me kuro mo asem ko wo tena se pa na wo so mo mo jiska no pra ma. And the other side mo na eje because running say yereje. Mahama yereje.
Before you know, that's I've forgotten it. The one who said you be now.
And our current people in society, Kufo and Kwan Agena now two women who buy. It's I didn't know how woman, I didn't know that. I mean, many who say, Society, yeah, you're wrong. It is not a more BS. To be done upon more canning in our yard. But no many look at the said, your back and a friend ye be introduced. I didn't know what that. And Nana do never saw no perfect or sample. When we saw woman yaman be a bit more home here, we are mechanical one in the minimum to say the Bucra say cost. It's in Adian woman chum. Yarba power by sending my brain or money dead. Nay, yam ran a down, say they my dear, any young man, and no one in the program and another no walk of our by any man or your cafe. Bufu chest, I walk around in New Castle, but so men can't be cry, men can't. What kind of chum abenya problem can see a crash actually they say crowd so best than possible. Because around and say it. Now, oh my can you know in the moji. Now, all but not in someone. Send someone can be see. If the wild party for, the hidden so general catching, so we have a do we are. It didn't pass what none of boss of our woman and Nadia. May there no attention because I near my time apostle. Some near my bibliohan and another buyer, a year sooner senior map of paper. But done it. So, yeah, Tagana. Yeah, Tagana, who got on Tanama Bay for the here for buy. Over 2 years, Uncle for the Tagana, one in him. Not done any beer now wet. Sir, on Tanama Bay for that terrorist to fool. Uncle for me and you be no mobile, and Uncle Kayan in your cossy you. Yeah, what do you so much? I want to hear with the apathy. Says, Nana, don't come to Okotiana Moka see a beer. I don't want to find some baby cradiaba. But the other family said, "Now, we'll move to Sana more running to Mahama. No, some Magana for the year wet. One will keep away in a secret. Yes, a fun, that would do for us the fun. Swung. Two. The American and other person near me now, what did two I did because near my war pass with you what I do. Yet, to I see what they say military base. Military base, no what Ghana what that do. A war, you already see about the at one time. I saw you for one Ghana hot that the free one vessel. I wish you wouldn't while we are doing it. You can't see a dang cake. A demonstration. I won't call you. Yanni, I said, Poncoso, every demonstration in the BC Ghana manual. Papa, but I mean, you know, what you didn't class out of Toso. Tadian or what the Avata will win the secret. Women and funny amount of Toso. Wrong. And the time you are quiet, Cardians and Aqua London will say. But I for when they by a Cardian and now on a day. Oh, it is a custom with the men of Mamma Francisca, make us a men of many you. So I say, I'm penny for you know. You try to look at why. It will be a yarding. I am a young to when they say, I am not the look to Sabaka, I did a penny you be introduced. I didn't go to the moon that. No more we take a son or we get no more you won't cry any to put a dorsal. Over the side, you know, 6. Over her says what I say. The 4 is a phone and over by once side number doors. What I know, woman to make an kitty. One parliamentarian for me. Party for so to make a whole demonstration because woman on the papa and someone you know buy. Will be up and also the CEO by here that cannot one paddy a muchum, and tea a mimi bufu is a wife I was say a mauska. And idea was yes, so. Woman castle. Sana no buy and as a wound to me to one. The Bible fast my brother. I would have wanted to manage system and I was again a TNY. So
we've lost Auntie Francesca. Mama make call line is on check caller or hello. Hello, Pacha Winey, UK number.
Yeah, hello.
Hi.
Yeah, good afternoon.
Good afternoon, sir. Me pacha why na wo hoy?
Yeah, I'm sorry, you're from Joe, my friend, Leeds.
Oh, excellent, Joe. Me pacha Leeds boko there.
Oh, Yamiadom. You think when Quadia, Yamiadom, Yahoya.
Amen. And then Uncle Joe, my being come my
Yo, Medawasi, for the opportunity. I think that this is the first time I was scrolling down on Facebook, and I who say, oh, live, and so it's the first time I listen to Rainbow Radio anyway, but it's the first time I'm listening to your program.
Oh, that's beautiful. Thank you.
Yeah. I'm also, your friend is saying, a bit attracted to semi-air course regarding former president's payment and all this. I mean, the happenings in Ghana, to put it in that broader perspective.
And you get things off your chest. My being come my
Yeah, that's it. Now, make sure it's here for both your listeners and your viewers on Facebook. One of the problems I've always said, how my Ghana, hypocrisy in our and partisan politics. I mean, the partisan politics, it play a role when it is about tribal bigotry. Hey, we in the club ni we say baby obi ame oho nke my empano kre and two baby eda. Mama, me gidi say in any political dispensation and even in the practice of democracy, no, say abide betna so. Na say oya ade of mine na pa me gidi say ebe to the ana meboa.
There be.
Upe sugar, ukwa sugar na ho free. Upe school, ukwa school na ho free. And then abide e ko to ala ube tu because we dey all them out. Na me gidi say bibi enko so yie enu nti na yete san aban. Thinking say wo dey wo be ye obi abeso man no owi aye wan dey obesome nta dey be kam. Wo some ye no wa ye wo dey be ma baby wan be ni na nti no kono obi so omra nimbi ono so wo. Enu nti na yeto abama na na do. Enti sa dey wo ho dadado say ni ho dadado. Yen say dey wo ho na enye nti na yete bra na besan ne oma. And they say, oh, that so the old Bible formalizing, what the video that was movie who say the inside and yet, yes, another for high plane your the bar, France, he Bosian of the boy of a ball France. France, what is that France, you or my pain, Boris Johnson, or what or your prime minister, no what year of our girl France, or any year Baby Day, near Tuana, the girlfriend near Tuana. And then all of a sudden, because you beat, or the formalizing, young kind of prayer, young kind of mammy, woman kind of call mining.
Adam Pacho Bibi Tramaji Musi Boris Johnson, partner na Tuani Canisano, and yes, Anna Miteno.
Maybe second, yes, it's only Boris Johnson, Tuana.
There be in Tiamuka. It doesn't happen in the Western world. Me, Tiana correct me.
Yeah. It is emphasized the other thing I got at the ATA.
And I will say chum, Sana, I will say, and yes, ye behind one, I say any day, behind one near the banny chum. And yes, I near the behind with young formalizing is that we want to give them a job and as young farm, my homo. Yeah, advertising that OBR apply. So, President, you in yeah, that's fine. The office, in the budget, this is what you do. Every year, be and you bet audit too. But yeah, account my and I say, whatever. And then, yes, sir.
Yeah, Auntie, I do not even agree with the fact that young formalize and I did. Look, Nanado, you enrich here just last month. Nigeria Libya the man $500,000 to run her foundation. Maybe to a low NGO Ghana. I'm a boy in Jankania. When I'm a miscada. What is Obiama miscada? But because of your man paying you $500,000, Nigeria Libya a channel. So the said one foundation of Ghana. It's already. What they are getting is enough. Also, when me papa your mind is demand for 32 good years. Or me mama ko baby a demand no man na car man ko. Na na be you ko baby ya man na car nya aban car no dem free. Enya aban fuel no dem free. Into what is the formalization of anything? It is not good whether it was paid to Mahama or was paid to Kwame Nkrumah and yet obi enu asabe the job description is just ya fa wadwuma yentia wo yere ka na yentia. Look, the criminality of our parliament where omo ye no otira the next person will be the speaker of parliament. The president no vice no anya speaker na ho say yentia ono so yere ka after speaker chief justice subeba ono say president no vice no speaker no ono so na ho yenti ono so yereka na parliamentarians so enya the effort to also come and say yenti ono so mo yere no ka
and so now go for go horse safa bi pe baby ada wo kra omunya nkwala pe school dai matena so ya de yenya why
Efana ye chane nye nti ye tia broche yen so we are in the enlightened world yen ena ye say ya advice say ye nuanu mo Ghana na omo de NDC FPP na say omo say akata omo ni na omo di go no ye na ye say enlighten omo wuti kromo a wo ko wo a wo wo opom wuti kromo a wo ya de atia na ye ma wo over benefit eno no ye mpresi ye be bia ama ye nuanu ne ye sister mo ne ye maame mo da we Chanu echi ya mami obi akwanyem okowo ne be ya conjoint point yo mo eni ekroma sabye ne abetna abroche kaka dabe no wan to obi akwakowo asebe ne bana ewo deficiency bia ye de ababetu media ye tre tikara
yeah jiji sika hwana GoFundMe ni whatever crowdfund ne and sana yetimi anya ska de akoye surgery how bizarre, how sad.
But ye sika ye bisi anana ye sabi ye ke be mu atese ye de purpose over 31 billion
because you say em back dating in 2017 hey
yeah and ye me papa why you ma 32 good years I see em back dating me ma payment na because o man na na do na mahama ne ko form dia o ye na ye dia go na sasa so no nyame de sasa so ma ye na and you see to sum up na obi so mbra no Minyanum ne ade omuso mu NDC na omoto wona omuso mu tiri say when a mistake happens that they want to capitalize on that mistake and now say the excuse for language the stupidity of the government to power no omuso mu power to come and steal more no momo de yan to ka ma MPs ni de you are there Mr. Sami papa bi ka say ka ban ne jam MPs in there no MPs don't pay for my knowledge MPs don't pay 71 million or so 71 million, you talk car $85,000 for 4 years. And he now bet you every month. Now you $85,000 maybe. And yes, a Tadia, Munkoti be my teacher for you now, $85,000 teacher no bet you 4 years. Muti be my nurse for you now. Look, we come to a state we need have always said a formalized pay structure. And people Yenya dia enye so incentive obi odo man na dokwa corporate or pay MP. In the MP teacher did 50 million, SMP to 50 million. Who person we teacher, or a buying talker ma, who person we MP a buying talker ma. And they say over here the phone will to a crowd was now parliament. It's okay. In this country we are. And American yeah go say young fuck 7 young country and mom war is here, demand what is right. A come why na talk ma MP. Minister Kobedia, there is a pool of car in the government. You go and sign and use that pool of car and bring it back. When I talk about MP and a minister who go ma, and see in I am near defending 77 some whom you are supposed to be defending all because they are NDC for and they are MP before. Ye in I ever no be blasting. Ye in I say this year another novel to an a Wa ukoye four more no what was maybe I would have would already taken and chip. But one and every war, you only for anything. Ye na ebebre.
Uncle Joe, what can say ye paka 3 minutes na me time so na ne mechanic say I say ye NPP say ye NDC 4 more for Nana I think say NPP for NDC for mo beti me say I don't understand say obi be ba be president na okona wasiaba isn't there anybody else in the NDC party obeti me a contested for akunyana na and yes I dey emfa NDC NPP in China a different party man so mention yon person we what you know say Uncle Joe 1 minute.
Auntie, that is not my case. And there's some of Professor Mo Saman Crab and Family because maybe I don't believe in NDC so bad be Papa the same way I don't believe NDC be the Papa dia. No, yes, and say young on my back for me. Yen is demanding because he has a Brazilian is a Boris Johnson Jana car. Nana do so say you Jimmy you say you Jimmy you Nana Abrochino tonight. Would you say you have benefit the man for but Ghana who say Ghana for Jimmy take advantage into say ye Jimmy no near demand there. Nana will do the right thing. The same way Mahama, when you beba say you just Jimino, you die tribal belonging and political color now. Me did it to be about the fact.
Uncle, why are them patch? I know I watch your language in the Kakrachi media thinks that it's a bit strong, but that's it. But anyway, time to call into wrap it up, mommy. Now next time, now you're saying to us every Sunday, be I say, Yamin Kumina meeting come 1 to 4. You will have I would do now a football no support it any for.
Oh, me war England in Quadi. I'm for England. I'm hoping they win it.
Is it hope and I say faith and I say, oh, you're sure say England by winning?
I'm not a prophet. I know your friends to do for Brazil, but we have for come and say I'm the one that's not my way. But I am praying and hoping say England will win, and that is what I desire. Say England.
And you're not with you in your home now, Uncle Joe. I mean, sure, I saw what friend from Leeds now, so they will contribution about. Amen. Bye bye. Ada funum semi na aso. It's just so unfortunate that I grown here then. Not just a time so obi a wetie me na bia me da wase, especially why one friend and our friend. I said why yeah can in make it sense ma wo baby a wo no. Yeah, that was me say I said opportunity to make a difference. I do make it. Then I make kind say yeah quite sorry na name room no. Untimi nko bi fie mfa Bible nko say me be kanya me so much of. Sometimes no cause all the Bible no kokko no bi anim kra. It doesn't do much for them these days. These things na no. And no and trying to say they will make a difference. Firstly Dr. Apraku me that was Dr. Nana Apraku Oppong me that only obusia say Carlos or say to band only obusia meaning someone share more auntie kese pa Linda for akwabuatin when Sharon ne Frank ne sister Nana nyame chichiro mure auntie our course income is your mom who has passed away tragically a week today te munyina nyame enshamu de na onshamu so ne na watwe ebesim na enya different mamo. Lastly, so where do your birthday? Happy birthday to you. Me pon 4 o'clock. But mama yentie akwabwanyum na enkuli down kakra why. I'm say 10 personal flair too much. Akwabwa said I love you. And today's a message for me to all the viewers and listeners. I love you all. Yamin Shramu.
Still can't believe this. I can't believe I can't take control of myself, baby.
I've been pointing on them, Nino.
Makuma boy, me bang bang bang. Me feel and answer me now my own corner me kosun, baby. Enka, Mr. Playboy, dear. Kabani send a me who about mama kuma boy me bang bang bang. But this feeling is so different. What reason will I give my heart if I should let you go, baby? Cause I wanna know you. And this sweetie, me person me new deal, go walk it to baby. I shall be so sad to see me.
Emma Mia Wolverhampton, thank you. I say excellent show. I love you. Me chakwab na way.
Baby. You're the one, you're the only one, you're my diamond girl. I wanna be with you forever, forever, oh, forever, forever. I wonder if your father was a saint, cause someone stole the stars from the sky and put them in your eyes. Girl, I'm not saying things just to flatter you, but every bit of what I say comes from within my heart. So then send me why. Oh, dear, shall we move if your name, man, what found Sakama Puma dress in your hair was so. Man can't show up, my but to make an idea, my Jimmy 3 points. What reason would I have given my heart if I let you go, baby? Cause I know I love you, I know I love you. But this sweetie, my team in the wedding, come over here. I tell me, yeah, I'm so bad. And mommy, why I'm mad if you say I love you? Girl, I wanna marry you. Girl, I live without you.
beautiful Arthur family, Champion Hill, Uncle Joe, Mama Linda, Michamunina.
I wanna be with you forever. The darling now, watching this, everybody. To me, dance for who die on core. Depending on some of me, like just have you be, but I'm so. Cause girl, I wanna spend the rest of my love with you.
Number one champion, Rainbow Radio. Yo, 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 Africa's best station. Yeah. Yo, yo, Rainbow Radio. Radio. Africa's best station. Hey, yo, non-stop music, we are flow. Shatta Rocco says so. I don't know.
Hey, order for no I'm saying I'm really mommy crying at me do me time now. So the absolute last song I'm going to play is Koda or see Hosanna. And you know, I hope someone would do my birthday, you know, and they, you know, more enjoy this song. I have to borrow extra time. I'm gonna log off soon. Nana, my Lady V, Vida, Amazing Grace, it's your birthday today. Sister Vern Gentles, and they your birthday. Elder Moses, Slough, SDHS, Jackie Asantimes, my beautiful cousin and sister who is a lawyer in Ghana, and their birthday. Eugene Brown, and everyone who has had their birthday or celebrating their birthday either this week or today, no. Nyame Eshabu. To the song I'm playing for you, Koda, or see Hosanna. Madam one say, Sipa Munti Minka be away, semi pom 4 at UK time. Nyame add my Rebecca son next week. And I pray, sir, Mom, what you do say England be winning, no. Yeah, you know I am winning. To take care, God bless you for the love. And then next Sunday, it's in come out, Monsambra, and that ending come up. Auntie Flores or Ceylon in Ghana SDA Church. Enjoy you, me mommy. Why Auntie Francesca watch also enjoy, mommy. And of course, Mama Linda Santua also enjoy.
All the Satan power.
Mr. Boachi of Ghana Revenue Service, Sir Emmanuel Akufo saying wish you happy belated birthday, Emmanuel.
All the Satan power, 'cause I ain't in Kunimo. See, I'm an overcomer. I say yes, wedding Kuni. Yes, wedding Kuni. All the Satan power. I'm an overcomer. I say yes, wedding queen. Yes, wedding queen. Over Satan power. I'm an overcomer. I'm into Hosanna. Hosanna. I'm into Hosanna. Jesus, Hosanna. I'm for Hosanna.
ready, Kunimo. See, I'm an overcomer. Listen, no weapon fashioned against me shall prosper. For the greater one lives in me, yes, it does, yes. It's ready, Kunimo. See, I'm an overcomer. I say, yes, ready, Kunim.
Yes, ready, Kunim.
I'll say,
over Satan power.
Sister Beatrice Asante, I noticed you're there. Thank you for the likes and the shares and everything. God bless you.
Over Satan power.
And Sister Queer D, Germany, thank you.
I'm an overcomer. Hosanna.
I am for the Narba. Jesus Narbano. I am for the Narba. One year to Hosanna. I mean, I won't bother say. Jesus Narbano. I am for the Narba. Kojo, come on.
I love Rainbow Radio. Many